afternoon and welcome to the opening ceremony of the World Bio Summit 2024. The World Bio Summit is co-hosted by the Ministry of Health and Welfare of the Republic of Korea and the World Health Organization. And before we begin this meaningful occasion, please allow me to introduce myself. My name is Jessica Seung-hee Lee, and it is with my great honor and pleasure that I have the opportunity to serve as your MC for this very distinguished occasion. On behalf of the organizers, we'd like to extend our sincere of Trinidad and Tobago. Last but not least, His Excellency, Mr. Hector Figueredo Notario, Chair of the Industry Committee of the Paraguayan Chamber of Deputies. And this year's summit brings also together our vice ministers from around the world, heads of international organizations, academic experts, and the CEOs of global pharmaceutical companies to discuss future investments for a healthy and secure decade. We are very proud to host this year the third edition of the World Bio Summit, and the 2024 World Bio Summit commenced today with this opening ceremony, followed by the first session and a special session, and the next day, which is tomorrow, we will also have 2 additional main sessions as well. And over the course of the summit, 5 side events will take place, and this summit will conclude with a closing ceremony summarizing the events of our 2-day-long journey. And ladies and gentlemen, we kindly ask your continued attention and participation throughout the duration of this event. And this event is currently being live streamed on the official YouTube channel. You can join us by searching for World Bio Summit on the YouTube channel. So ladies and gentlemen, we ask for your active participation until the very end. Then now, without further ado, let us commence the World Bio Summit 2024. Thank you. And before we officially begin, let us watch the opening video, which will set the tone for the World Bio Summit. Ladies and gentlemen, please draw your attention to the screen.
The COVID-19 pandemic exposed vast inequalities in access to life-saving medical countermeasures. It sparked the global community to significantly increase research, development, and production of countermeasures.
공동의 비전을 바탕으로 한 국가 간의 연대와 협력 그리고 기술 혁신은 세계 시민의 건강을 지키고 인류의 번영을 가져다 줄 것입니다. 아울러 바이오 기술과 산업의 획기적인 발전은 우리 인류를 더 안전하고 건강한 삶으로 이끌 것입니다.
Ladies and gentlemen, please give a big round of applause for the successful launching of this year's summit. Thank you. Thank you for watching this video together. So this video showcased the theme of this year's World Bio Summit 2024, Future Investments for a Healthy and a Secure Decade. Over the course of the summit, we have arranged a variety of sessions. We encourage each and everyone to please come together and elaborate your expertise to address the pressing challenges ahead. Thank you. Then we will commence the opening of this summit with the remarks delivered from His Excellency, Mr. Cho Kyu-hong, a Minister of Health and Welfare of the Republic of Korea, the host of this event. Ladies and gentlemen, now please join me in welcoming him with a big round of applause.
Good afternoon, ladies and gentlemen, distinguished guests. I am Cho Kyu-hong, Minister of Health and Welfare of the Republic of Korea. It's my honor to welcome all of you to the 2024 World Bio Summit. Distinguished leaders from around the world, representatives from governments, international organizations, private institutions and companies. It's a pleasure to meet you in Korea. My deepest gratitude is extended to the World Health Organization for preparing this 2024 World Bio Summit in cooperation with the government of the Republic of Korea. All of us have gathered here today under the auspices of this summit to consider the theme of future investments for a healthy and secure decade. This is a continuation from the last 2 years of the World Bio Summit. In 2022, we focused on the future of vaccines and biohealth. And in 2023, we discussed on the specific measures to strengthen pandemic response capabilities. And now this year, as we conceptualize the future investments for healthy and secure decade, we will have in-depth discussions centered on 3 key topics: innovative research and development, building a global supply chain, and development of the human resources. We have realized for some time that we need not just the efforts of one or a few countries, but the participation and the cooperation of the entire world if we are to effectively and realistically promote health and health security in the future. Therefore, it is vital to strengthen the international cooperation and to seek tangible results through global fora such as this summit. The COVID-19 pandemic was a new type of struggle for the humanity in recent memory, but through transnational solidarity and cooperation, we were able to find hope and eventually overcome it. We were able to reduce the time for the development of the COVID-19 vaccine from 10 years to 1 year. And this was a shining achievement of humanity in a time of crisis through innovative research and development. And through close international cooperation shown by the international supply chain, COVAX, which enabled us to quickly distribute the vaccines to the entire world. As a part of these global collective efforts, the Korean government and the World Health Organization worked together to establish the global training hub for biomanufacturing workforce system and made crucial contributions to developing the professional human resources for vaccine production. However, we continue to be faced with new challenges and difficulties that threaten the survival of humanity, such as climate change, potential emergence of other infectious diseases, and the overall health security around the world. For a healthy and secure decade and beyond, now must be the starting point of preparation. This is the essence of the future investments that we are currently pursuing. To this end, the Korean government is expanding its investments for healthy and secure future. We are launching the Korean ARPA-H project, the Advanced Research Project Agency for Health Project, for innovative research and development that will change the world. We are expanding global joint research project that will see the world's leading scientists participate. In particular, we have established the right foundation through joint investment with the Bill and Melinda Gates Foundation. And we are supporting needed research and development projects in the low and middle income countries. To train more than 2,000 global vaccine production personnel per year, we opened the Global Bio Campus as the exclusive training venue of the Global Training Hub for Biomanufacturing in Songdo this year, and increased voluntary contributions to the WHO by more than 3 times. The Korean government intends to create a venue for cooperation in which global leaders can participate. In investment plans for research and development, supply chains, and human resource development for the future. This World Bio Summit is the basis for that goal. Starting with this opening ceremony and the innovative R&D and vaccination promotion sessions today, there will be discussions tomorrow on supply chain building and human resource development, along with side events held by various international organizations. They will discuss global governance of medical AI, Asian networks for diagnostic devices, vaccines, and therapeutics. In preparations for pandemic response, R&D for vaccines and therapeutics, and equitable access to the R&D. In addition, various networking events have been prepared to allow opportunities for cooperation and trust building among governments, international organizations, private institutions, and bio companies. I sincerely hope that the 2024 World Bio Summit will be a memorable occasion to once again remind us of the importance of global cooperation for a healthy and secure future for the humanity, and that it will serve as an effective opportunity for progress in the areas of innovative R&D, supply chains, and human resource development. Once again, I would like to thank all of you, distinguished guests and participants who have come to the 2024 World Bio Summit on this beautiful autumn day in Korea. However, short or long your stay may be, I hope you will make happy memories in Korea. Thank you very much.
Thank you, Minister, for your leadership. Thank you. As the Minister just mentioned, the world has successfully navigated the prolonged and challenging COVID-19 pandemic. And we're very confident that today's gathering will provide an invaluable opportunity to reinforce our cooperative framework, enabling us to proactively address any future crisis that might occur. Thank you once again for your leadership. And ladies and gentlemen, let's give another big round of applause to Minister Cho. Thank you for hosting this year's World Bio Summit as well. And ladies and gentlemen, as you might know well, the World Bio Summit is co-organized by the Ministry of Health and Welfare of the Republic of Korea and also the World Health Organization. So now we will have one more opening remarks delivered by our co-host. Up next, we are honored to invite Dr. Tedros Adhanom Ghebreyesus, Director General of the World Health Organization, to deliver his opening remarks. Unfortunately, he could not join us here in person, but he has sent us a very meaningful video message. So, ladies and gentlemen, let's welcome him onto the screen.
Honorable Minister Kyu Hong Cho, Honorable Ministers, dear colleagues and friends, Kamsahamnida. We live in a world of multiple overlapping health threats, from climate change to conflict, disease outbreaks, antimicrobial resistance, and the growing burden of non-communicable diseases. Collaboration, sharing knowledge, and targeted investment in research and development are essential for developing the innovative health products needed to meet these challenges. And it requires a skilled workforce to bring ideas to fruition. The WHO Biomanufacturing Workforce Training Initiative was established to support low and middle-income countries to strengthen their capacities for local manufacturing. The initiative comprised three complementary pillars: existing WHO capacity building activities, the Global Training Hub for Biomanufacturing, hosted by the Republic of Korea, and the regional training centers. Many countries were interested, as you remember, in hosting the hub. But one of the main reasons we decided to base it in the Republic of Korea was the strong commitment of the government, which I saw firsthand in meetings with officials from the National Assembly, the Ministry of Health and Welfare, the Ministry of Foreign Affairs, and the Food and Drug Safety Agency. WHO thanks the Republic of Korea for its partnership, which WHO looks forward to deepening in the years ahead to strengthen global health security, and look forward to working with you closely. By working together in solidarity, building expertise, and with sustainable investments, we can prepare and respond to the public health challenges of the future and build a healthier, safer future for all. I thank you. Kamsahamnida.
Thank you. Please give a huge round of applause. Thank you for helping us prepare this summit for a safer and a sustainable future. Thank you once again. And next, we have several health ministers and leaders who will be delivering their words of congratulations here at the site. First, please join me in welcoming His Excellency Dr. Saya Malpiukala, WHO Regional Director for the Western Pacific, to the stage. Ladies and gentlemen, let's welcome him with a big round of applause.
Honorable Cho Kyu-hong, the Minister of Health and Welfare of the Republic of Korea. My good friend, Honorable Bo Feng, the Minister of Health, Lao People's Democratic Republic. Honorable Terence Dayal Singh, the Minister of Health, Trinidad and Tobago. And Honorable Hector Notario, the National Deputy Chamber of Deputies, Paraguay. Distinguished officials and experts in biohealth, vaccines, and biomedical industries, colleagues, ladies and gentlemen, it is my great honor to join you at this year's World Bio Summit, a gathering where we explore the immense power and potential of biohealth innovations to promote, provide, and protect the health and well-being of all people. The importance of biohealth in healthcare and public health cannot be overstated. Today, we stand on the brink of extraordinary opportunities in biohealth, witnessing a fast shift from traditional products such as vaccines, blood products, and recombinant protein products to more advanced technologies such as cell and gene therapies and tissue and organ transplants. Biohealth innovations are transforming healthcare services. With advancements in personalized medicine, telemedicine, and integrated care models, we are not only improving patients' outcomes, but also improving access to essential treatments. Biohealth science is at the heart of WHO's mission to keep populations safe and healthy. It covers not only the biological basis of health and disease, but also approaches to health promotion and healthcare delivery. For over 75 years, WHO has championed health research that has led to remarkable achievements like the successful eradication of smallpox and a 99% reduction in polio cases. WHO's commitment to advancing HIV/AIDS research contributed to the development of antiretroviral therapies and effective prevention strategies. In the fight against malaria, we promoted bed nets, deployed anti-malaria trucks, and celebrated the introduction of a new vaccine. During the COVID-19 pandemic, WHO coordinated research for rapid vaccine and diagnostic development. These achievements underscore what we can accomplish through science, solutions, and solidarity. They are reminders of the profound impact that biohealth innovations have on global health outcomes. Our work with the government of the Republic of Korea on the Global Training Hub for Biomanufacturing supports mRNA technology transfer and biomanufacturing workforce development, enabling countries to bolster their biohealth capacities. This World Bio Summit, we also have an opportunity to exchange knowledge and insights. Let us engage in meaningful dialogue and explore collaborative strategies that will bolster health security through biohealth science, research, and development. I applaud the government of the Republic of Korea for its vision and generosity in hosting this event. Your leadership in fostering international cooperation around biohealth is invaluable. Ladies and gentlemen, together we can unlock the full potential of biohealth innovations. We can ensure that they reach those who need them most. And we can also ensure that these advancements are developed ethically, are grounded in robust data and evidence, and are used responsibly. As we look ahead, Let us commit to transforming the immense promise of biohealth into tangible benefits for people everywhere. May this summit inspire bold ideas, strengthen partnerships, and drive us towards a healthier, safer, and a more resilient future for all. I thank you.
Thank you very much. Please give a huge round of applause. Thank you, Minister. And thank you very much for those valuable remarks on advancing public health and also emphasizing the importance of cooperation among biohealth leaders. Thank you once again for those meaningful words. And next, we have the honor to invite His Excellency, Mr. Boonfeng Pumalaith, the Minister of Health and Welfare of Laos, to give us his words of congratulations. Ladies and gentlemen, please welcome him with a warm round of applause.
Your Excellencies, Ministers, distinguished delegates, ladies and gentlemen. It is an honor to be here today on behalf of the Lao PDR at the opening ceremony of the World Bio Summit 2024. This prestigious event marks a significant milestone in our journey toward advancing global biohealth, showcasing innovation and fostering partnership that are crucial for a resilient and sustainable future. We extend our heartfelt congratulations to the government of the Republic of Korea and the summit organizer for their commitment to strengthening international collaboration in biotechnologies and healthcare. This gathering underscores the importance of collective efforts in addressing global health challenges, especially as we move beyond the pandemic era and into a period of rebuilding and innovation. For Laos, participating in this summit offers an invaluable opportunity to learn, exchange, and collaborate. We are committed to advancing biohealth in ways that enhance our healthcare systems, empower our communities, and contribute to ASEAN vision for a healthy and resilient region. Together with our international partners, we aim to make tangible progress in public health, ensuring that no one is left behind in our shared pursuit of wellness and health security. Once again, congratulations to all involved in making this summit possible. May our discussion here be fruitful and lead to impactful solutions that benefit not only our nations, but also the world as a whole. I thank you very much.
Your Excellency, thank you, and please give a huge round of applause. Thank you. We deeply appreciate your leadership and guidance in working towards a safer and healthier world. Thank you once again. And ladies and gentlemen, now it is my great honor to welcome His Excellency, Mr. Terence Dale Singh, the Minister of Health of Trinidad and Tobago, for his welcoming address. Please welcome him with a big round of applause to the stage.
Thank you and good afternoon. May I recognize in absentia Dr. Tedros Atamon Ghebreyesus, Director General, WHO. May I recognize and thank our host, Minister Chu Kyu Hong, Minister of Health and Welfare, Republic of Korea. Members of the head table, honored guests, colleagues all. I am humbled to offer remarks at this 2024 World Bio Summit, aptly titled Future Innovation for a Healthy and Secure Decade. COVID-19 uncovered both the strengths and weaknesses of the global healthcare system. Heroes and heroines were born in the face of death and suffering, and so lessons must be learned. Once again, I say a heartfelt thank you to all healthcare workers. I therefore congratulate Dr. Tedros and our most gracious host for hosting this most timely intervention. Colleagues, zoonotic diseases and biohazards are not constrained by borders, political affiliation, racial differences, or socio-economic distinctions. This is reflected in the theme, the triad of commitments: bio-innovations, strengthening public health infrastructure, and enhancing global collaboration for collective security. Trinidad and Tobago identifies with these objectives. Permit me to reflect on weaknesses that we in a developed country grappled with during COVID-19, and they are vaccine inequity, vaccine conspiracy theories resulting in vaccine hesitancy, and how the protection of intellectual property rights may not have served a humanitarian purpose in the face of over 7 million deaths. Barriers to collaboration must be overcome. These comments are germane to the special session on vaccine accessibility across the life cycle. Colleagues all, vaccine hesitancy poses an existential threat to humanity, and Trinidad and Tobago is not immune to this. And we, as a scientific community, must prevent this movement from growing even deeper roots that were laid as early as 1796. Failure is not an option. The gains made in vaccinations must not be lost to the present, yes, the present, and future generations. We must be heartened to learn that Korea will play a vital role in the production of vaccines in the future, and I congratulate Korea. In closing, profound congratulations to WHO and the Republic of Korea for hosting this event. I look forward to the learning to be had, and I look forward to concrete decisions that will benefit all of humanity. Our dear host minister, future decision makers will look back at this event as a landmark one, where good people all of us, came together in solidarity to do good for all the good peoples of the world. I thank you.
Thank you very much for those valuable words. He just emphasized the importance of collective cooperation in delivering safe, effective, and affordable countermeasures against infectious diseases. Thank you very much. And last but not least, we'd like to welcome His Excellency, Mr. Hector Figueiredo Notario, Chair of the Industry Committee of the Paraguayan Chamber of Deputies, to share his remarks. And his remark will be delivered in Spanish, and I will interpret it into English. With that, please welcome him with a big round of applause.
Estimado señor Kyo Hom Jo, Ministro de Salud y Bienestar de Corea, Dr. Tedros Adhanom Ghebreyesus, Director General de la Organización Mundial de la Salud, damas y caballeros, muy buenas tardes a todos los presentes.
Dear Cho Kyu-hong, Minister of Health and Welfare of the Republic of Korea, Dr. Tedros Adhanom Ghebreyesus, Director General of the WHO, ladies and gentlemen, good afternoon and welcome.
Agradecido por estar una vez más en Corea a través del Ministerio de Salud y Bienestar. Gracias a Su Excelencia el Ministro Cho Kyung-hom, quien en colaboración con la Organización Mundial de la Salud hacen posible la Cumbre Mundial de Biotecnología del 2024 bajo el lema Inversiones futuras para una década saludable y segura.
I'm truly grateful to be here in Korea once again, thanks to His Excellency Minister Cho Kyu-hong and the Ministry of Health and Welfare of the Republic of Korea, whose collaboration with the World Health Organization made this World Bio Summit 2024 possible under the theme of Future Investments for a Healthy and Secure Decade.
Es un gran honor para mí compartir este espacio con todos ustedes, teniendo en cuenta que es un evento internacional muy importante, donde nos reunimos para debatir agendas globales en los sectores de vacuna y biotecnología.
It is a great honor to be here with all of you at this important international event where we will have the opportunity to discuss global agendas in the vaccine and biotechnology sectors.
Quiero agradecer también a la Embajada de la República de Corea en mi querido Paraguay por estar siempre atentos a trabajar en estrategias de cooperación global en cada área, apoyar la expansión de trabajo entre organizaciones internacionales, empresas globales, ministerios de salud extranjeros y empresas biológicas coreanas.
I'd like to express my sincere gratitude to the Embassy of the Republic of Korea in Paraguay for its continuous openness to collaborate on global cooperation strategies and for its support in fostering partnerships between international organizations, global companies, foreign health ministries, and the Korea biotechnology companies as well.
Señor Ministro Cho Kyung-hom, agradezco su invitación a este evento de gran envergadura, que hoy es un instrumento muy valioso para Paraguay y la República de Corea, que nos ayudará a la estrecha colaboración entre los gobiernos y la comunidad internacional en diversas áreas, incluido el control eficaz de las enfermedades infecciosas, garantizar un suministro estable de medicamentos durante las crisis, proteger a la sociedad civil durante el proceso de desarrollo de vacunas y proporcionar herramientas digitales accesibles y eficaces.
Mr. Minister Cho Kyu-hong, I sincerely thank you for your kind invitation to attend this important event, which serves as a valuable opportunity for Paraguay. I'm very confident that the Republic of Korea will support us in achieving closer collaboration between governments and the international community across various areas, including the effective control of infectious diseases, ensuring a stable supply of medicines during crisis, protecting civil society throughout the vaccine development process, and providing accessible and effective digital tools.
En un momento en que las tecnologías científicas innovadoras y la inteligencia colectiva son más cruciales que nunca para preparar un futuro saludable y seguro, las ideas que surjan en este evento serán un activo invaluable para el sector de biotecnología.
At a time when innovative scientific technologies and collaborative intelligence are more essential than ever in preparing for a healthy and a safe future, the ideas generated at this event or summit will serve as an invaluable asset to the biotechnology sector.
Deseo siempre que la colaboración y lazos bilaterales que nos unen, como así también los lazos económicos, se fortalezcan aún más. Hoy estamos al otro lado del planeta para conocernos y presentar cómo es nuestro querido Paraguay. Insisto en que mi país hoy día emerge como un potencial epicentro de la industria médica y a través del trabajo en conjunto entre la República de Corea y Paraguay buscamos potenciar a nuestro país en el campo médico, demostrar la competitividad de la industria paraguaya a nivel regional, facilitar la transferencia de conocimientos de la industria médica 4.0 de Corea del Sur a la infraestructura médica de Paraguay, fomentar la inversión de compañías coreanas en la industria farmacéutica paraguaya, entre otros proyectos.
I hope that the cooperation and bilateral ties that unite us, along with our economic relations, will continue to grow stronger. Today, we have traveled to the other side of the world to meet you and introduce you to Paraguay. My country is emerging as a potential epicenter of the medical industry, and through the collaboration between the Republic of Korea and Paraguay, we aim to strengthen the medical sector, highlight the competitiveness of the Paraguayan industry at a regional level, facilitate the transfer of knowledge from South Korea's medical industry 4.0 to Paraguay's healthcare infrastructure, and also encourage investment by Korean companies in Paraguay's pharmaceutical sector, among other initiatives.
Desde la Cámara de Diputados, en mi carácter de legislador y presidente de la Comisión de Amistad entre la República de Corea y Paraguay, me pongo a disposición para apoyar y respaldar con propuestas legislativas las iniciativas y colaboraciones entre Paraguay y Corea del Sur que prometen un futuro vibrante para la industria médica paraguaya.
As a legislator and a president of the Friendship Commission between the Republic of Korea and Paraguay, representing the Chamber of Deputies, I'm committed to supporting initiatives and collaborations between Paraguay and South Korea that promise a bright future for the Paraguayan medical industry.
Los desafíos existen, pero no son imposibles de superar. Con este encuentro buscamos identificar juntos avanzar para que la industria biomédica crezca en pos del bienestar de nuestros pueblos y que al mismo tiempo sirva como puente para estrechar nuestros vínculos de amistad de más de 60 años. Muchas gracias.
While challenges remain, they are not impossible to overcome. Through this meeting, we hope to move forward together, fostering the growth of the biomedical industry for the well-being of our people, while simultaneously serving as a bridge to further strengthen the bonds or friendship that have united us for over 60 years. Thank you very much. Ladies and gentlemen, please give a huge round of applause. Thank you for those valuable remarks. Thank you. And ladies and gentlemen, before we close the opening ceremony, we will have a brief moment to take a group photo shoot. And ladies and gentlemen, while we take a moment to prepare the stage, allow me to briefly reintroduce this year's summit. The World Bio Summit 2024 is an event where global leaders in the bio health sector gather to share the latest trends in this industry. It serves as a platform for discussing and strengthening the global supply chain, fostering intergovernmental solidarity and cooperation to establish a stable global supply network. So this distinguished gathering will provide a platform for in-depth discussion of collaborative international strategies aimed at enhancing health security through advancement in research and development, robust supply chains, and comprehensive workforce development as well. So we do have 3 main sessions today and tomorrow. And ladies and gentlemen, tomorrow we will have a second and third session at the other side of this venue. And please note that we do also have 5 side events placing right now, and a business lounge to provide a platform for meaningful collaboration and dialogue between companies as well. And over the 2-day-long summit, we will review our achievements in building a pandemic preparedness and response ecosystem, also showcase where and how we could move forward. We ask for your continued interest and participation. Thank you. And now we will have a group photo shoot here up on the stage. We will have 2 rounds of photo shoots. For the first photo shoot, we'd like to welcome our ministers and esteemed guests for sitting at the head table number 1 and 2. So those who are sitting at the head table number 1 and 2, please come up to the stage and join this photo shoot. Thank you very much for your presence. Thank you for honoring us with your presence and remarks as well. Please come up to the stage. we'd like to ask our esteemed guests, please come up to the stage and join this photo shoot. And please follow the guidance of our staff members and make sure that we are at the center of the stage. Can we make a 2-step towards your right-hand side? Can we move a little bit to your right-hand side? 2-step. Thank you. Please move to your right side a little bit so that we can be at the center. And we have the center one, main camera right there, up there. So please look at the camera. Show your huge smile towards the camera as well. Thank you very much. And we'd like to welcome our esteemed guests who are sitting in the first row. Please stand up and please come up to the stage and join this photo shoot. Please come up to the stage. And those who are sitting at the table number 1, 2, 3, 4, we'd like to ask you to please join this photo session. And please step up. We have a little stairs up on the stage. So please go up and make 2 lines so that we can see your face as well. Make sure that we're standing between people in front of us. 네, 사이사이에 얼굴이 좀 잘 보이도록 서주시고요. 사진 촬영 바로 진행하겠습니다. I believe we're almost ready to take a photo shoot. And please follow the guidance of our staff members so that we can see your face as well. Thank you. Can we, yes, our gentlemen, thank you. And we will have 3 photo shoot this time. Please look at the camera up there. Let's make a huge smile. Thank you. And for the next photo shoot, we'll do this cheer up. This is fighting pose in Korea. So please use your right hand and let's do this together. Maintain your pose. World Bio Summit 2024. Fighting! Look at the camera once again. Maintain your pose. Thank you. And for our last photo shoot, as we applaud, we will change the background and have one more photo shoot. Let's maintain giving a big round of applause for the successful launching of this year's summit. Ladies and gentlemen, please join us giving a warm round of applause. Thank you very much. Please return to your seats. Thank you very much for your cooperation. 자리로 모시겠습니다. 고맙습니다. Your Excellencies, distinguished guests, ladies and gentlemen, thank you very much for your patience. We'll soon proceed to the first session of the World Bio Summit 2024, so we kindly ask you to please remain seated and stay in this room. We will soon begin the first session, and we will have a brief moment for preparation of the first session. So please be seated, and we'd like to ask you to please remain in this room. Thank you. 네, 저희 바로 이어서 첫 번째 본 세션 이 자리에서 시작하겠습니다. 네, 외 귀빈 여러분 또 참석자분들께서는 잠시만 자리를 지켜주시고 이 자리에 머물러 주시길 부탁드리겠습니다. 잠시 후 시작하겠습니다. And before we invite our keynote speaker to the stage, once again for your information, I'd like to remind you that we do have simultaneous interpretation service from Korean to English and vice versa. We do have our receivers on your tables. Please set to channel 2 for English. Thank you. And if you need any help, please ask our staff members around this venue. 네, 여러분 잠시 후 시작되는 기조 강연에서도 동시 통역 서비스 제공이 됩니다. 여기 계시는 국내 참석자분들께서는 오늘 리시버 채널 1번이 한국어입니다. 원하시는 언어로 설정해 주시고 유익한 시간 되시길 바라겠습니다. And we will soon commence this first main session of the World Bio Summit 2024. We ask for your cooperation. Thank you. We believe that now we are ready to welcome our esteemed speaker to the stage. Now let us continue with the keynote speech, and we are very honored to have with us next Dr. Yukiko Nakatani, Assistant Director General of the World Health Organization. Ladies and gentlemen, please join me in welcoming her to the stage.
So good afternoon for the honorable ministers and the distinguished participants, dear colleagues and friends, and ladies and gentlemen. So today I'm very great honor to be here to deliver the keynote speech as the Assistant Director General of the Access to the Medicine and the Health Product the divisions in WHO headquarters. Then, first of all, I'd like to thank to the Ministry of the Health and Welfare of the Republic of Korea for the co-organizing this important event and also hosting this event. Very well organized and very hospitality. Thank you very much on that. And also today, so I'd like to highlight of the current WHO's work regarding to the biologicals. And also, I would like to emphasize of the importance of the continuous collaboration across the world. Then here, when we are talking about ensuring the access to the quality assured health products, particularly biologicals, we should consider to the health products their technology ecosystem, which is including a lot of the components, as you can see on slide. This is not only the aspects on the product development, also includes the health systems, health infrastructure, funding and financing on the health systems, including the health insurance system. And also we have to consider for the health workforce and the proper use in the community. Then those holistic approach is required to achieve the real access in the healthcare system. Then we've been talking about the biosimilars. This is the example. We already are launching the biosimilars access toolkit. We highlighted that some of the aspects we have to move forward and collaborate with across the partners. Because the biosimilars is a really key opportunity for improved access to the biotherapeutics products with better affordability rather than the original products because of the cheaper than the original products. But still, there is a low availability in low and middle income countries because of the issues like a demand of the misinformation and the supply and the prices issues. Also, we are lack of the data or the supply on the market the issues. Also, the lack of the capacity to product in the local countries. Also, the regulations, IP trades. So those challenges, so we cannot achieve by alone. So no country can address these challenges alone. So please, considering these issues, including not only the low and middle income countries, so high income countries also facing these challenges. Then currently my division leading to revision of the WHO roadmap for access to the health products and technologies. There are comprehensive strategic work plan across WHO 3 levels we want to highlight of how important to the move forward as the comprehensive approaches. Not only one aspect, we have to find the synergy across the partners to achieve of the real access issues to the health products. Then here is the highlight of the WHO work on the biologicals. This is based on the ecosystem. We have the several issues. I don't go through all these elements today, but I would like to zoom out one of the activities, what I want to highlight it today. Then the first one, I would like to zoom out on the regulation and the pre-qualification program. Then actually, my division leading of this regulation and the pre-qualification program. Then we have to consider both aspects. The one is the capacity building of the national regulatory authority in the low and middle income countries. And the other aspect is providing the WHO pre-qualification program, which closely linked to the global supply management, the global supply, the procurement processes. Then this shows is the current status of the national regulatory authorities meet to which level of the capacity. Then there are a number of the member states. We are seeing that 66% of the countries already meet to some level of the capacity, but still missing many of the countries not reach out with enough capacity in the world. Then, if we can see in the population basis, more than half of the population already reached to the maturity, enough maturity level of the capacity and to meet to the international level of the standards. But still, we need to consider to expedite those issues to fill out the few gaps coming years. Then here is the pre-qualification program. There are some the product streams here, and the biologicals and the biosimilar are reviewed by the PQ medicines team. We already listed of the 15 the therapeutics and also 12 the biosimilar products in the list of the PQ. Then once the products listed in the PQ program or the emergency use listing in WHO, so automatically WHO coordinate of the within the national regulatory authority in the low and middle income countries to provide the basic information to them and then try to harmonize of the registration procedures in each country. This is the huge benefit for the local manufacturers to exporting their products in the low and middle income countries. Also, huge benefit to apply to the global supply management, global procurement mechanism. Also, some regional pooled procurement mechanism as well. Then now we are trying to expedite the procedure using the digital platform. We want to launching the EPQ system before next year, but we are struggling some of the system issues and the IT issues. We did that pilot study now, but we still take time to fully launching those systems yet. And also, we try to expedite this program together with the other disease departments which developing the WHO recommendation, particularly mentioning the specific products. So now we try to compress of the timeline of the finalize of the WHO guidance and the PQ program at the parallel way. Not normally they are sequential way taking the the twice or the more than 10 years, but we try to compress of those the procedure, the parallel way, develop the guidance, development, and the PQ processes together. Then WHO will commit at least 12 months to finalize all the both processes. Now we're working on the full implementation of this procedure internally. For example, we need to define what is the definition of the day 0 for the 12 months, and what is the definition of the dossier with the local manufacturer have to submit to the WHO, to both teams on the guidance and the PQ program. So I hope that we can launching the more details before during the Q1 next year. Then this is the second topic of the zoom out of the MHP, meaning the My Division, the special program. Then here is I will show the health technology transfer. We launched in the WHO Health Technology Access Program this year, early this year. This came from the two programs which established during the COVID-19. One is the CTAP and the other is the mRNA technology transfer program. Then, but after COVID, we need to expand our scope beyond the COVID-19. Then we try to institutionalize this program to increase of the resilience and the preparedness and for the coming future pandemic threat. Then currently we work closely with the SD biosensor in the Korean manufacturer. They kindly to provide their license of the rapid diagnostic test to the local manufacturer. Then we have the agreement with our with other stakeholders together to provide their license to the local manufacturer. Then we did the call for interest to the local manufacturer at the beginning of this year. Then now we received the application. Then now under the review for the selection of the recipient manufacturer, because we need to assess of the capacity of the recipient manufacturer. Also, we need to site visit on their infrastructure is leads to the GMP or not. So we did those things. They're hoping we can launch a finalize of the selection process. They are the first half of next year. And here is the mRNA technology transfer program. I think most of the people already know that program. Currently, we are working to develop of the R&D consortia in the regional level. In the Uplo region, as you can see in this slide, we already have done the first meeting of the consortia. That we invite in the IBI from the Korea for the R&D part. Because this program, the initiation of this program focus only COVID vaccine, but after COVID, there are no market. We cannot sustain this business model. So now we decided invite institutions from each region to prioritize what is the needs in the public health, what is the future demand together with government and the manufacturer. So we organized the consortia in the region level, and the Uplo region currently choosing some pathogens as priority of their regions. Then we already have done the PAHO region as well. Then we will organize the R&D consortia on the East Mediterranean region in February next year. Then I will organize the African region maybe the end of next year. That's the current work. Then here is the biomanufacturing workforce training initiative. So my Director General of WHO already mentioning at the opening speech. So I just quickly skip on that. But we already achieved this manufacturing to receiving a lot of the trainee around the world. In the cumulative number of the trainee is more than 750 trainees already have done. That's the training. Then, as you can see in this pie chart, that's the trainee came from all the 6 regions, including the African region and the UPRO region. So not only the UPRO region, because this is the global training hub. Then I'd like to highlight of the work on the local production. Then here is the main the pillar of the what local production and the assisted units and around the local production resolution. We WHO work on that. Then we will organize the 3rd edition of the World Local Production Forum in April next year in Abu Dhabi and hosted by the UAE. This is a very important opportunity for you. Please join in and participate at the World Local Production Forum. This forum not only target of the local production, this forum overseeing all the aspects of the health technology ecosystem, such as the R&D, regulation, and the supply chain, the pricing, the proper use. So please participate and make your schedule available. So I'm happy to see all of you in person in Abu Dhabi next April. Then this is my last slide. So lastly, I would like to emphasize again, so no country can address these access challenges alone. So we have to work together across the borders and the sectors beyond the health sector, maybe. And then we can address those issues, multidisciplinary access challenges, to really ensure the timely and equitable access of the biosimilars. And then also, please, together, then there are a lot of the issue around the ensuring the access to biologicals. But many people ask me, what is the challengeable issues around the biosimilars? That is very question, but very hard to answer because the challenges are different in each country. But I'm sure those challenges was covered by the comprehensive the strategic plan or the part of the ecosystem. So we need to exchange your experience. Also, we need to exchange your expertise, how we can collaborate those issues. So that is the fastest way to achieve the real access in the world. So this BioSummit, really important opportunity to exchange your experience with your partners, with your colleagues, your friends in the world. Then please find out concrete actions during this BioSummit, and you should do coming years, including myself. So this is a very opportunity, and then please have a fruitful and constructive discussion through this conference. So thank you very much for your attention.
Thank you, Dr. Yukiko Nakatani, for your valuable presentation. Thank you once again. And ladies and gentlemen, we will proceed to keynote discussion. And first, we would like to welcome Dr. Dame Angela MacLean, Chief Scientific Advisor of the Government of the United Kingdom, to the stage. Please welcome her with a big round of applause.
So thank you so much for the invitation to be here with you today. And thank you also, Dr. Nakatani, for that fascinating opening address. I am very happy to be on my second visit to Seoul as GCSA, and I have much to learn from the Republic of Korea's science system, from engineering biology to semiconductors, and of course also to pandemic preparedness. We in the UK greatly admired the Republic of Korea's response to COVID-19. We watched you applying the lessons you had learned from MERS, keeping cases low and achieving very high vaccination rates. And your commitment to global health security goes far beyond hosting this excellent summit. I particularly wanted to highlight the Republic of Korea's embrace of the 100 Days mission, first conceived in 2021 by my predecessor as Chief Scientist in the United Kingdom, Patrick Vallance, and also Melissa French-Gates. So the 100-day mission's goal is to make diagnostics, therapeutics, and vaccines available equitably within 100 days of a health emergency being declared. So it says, not only must we be able to meet all the access challenges listed by Dr. Nakatini, but we must also do those things very quickly. Of course, the 100-day mission clock is already running low on Mpox. It is almost 100 days since the emergency was declared. Mpox vaccine is being administered, but specific therapeutic options are very limited, and there are currently no effective rapid point-of-care tests that meet WHO target product profiles. So the Republic of Korea's continued leadership is essential. We welcome how they host the International Vaccine Institute headquarters, a greatly valued partner in CEPI. And your domestic firm, SK Biosciences, is already producing rapid mRNA platform technologies to help us counter disease X. So let me urge everybody in this room, every representative of other nations, to support the 100-day mission. The 100-day mission specifies technologies that are essential to pandemic response, but even they are not sufficient. And one very close topic that really is close to my heart is the question of data sharing, both essential data for pandemic control within countries, but also the sharing of data and insights between chief scientists and their ilk is vital. And again, the Republic of Korea's actions were exemplary in this respect from the earliest days of COVID-19. So I think we would all agree that both preparation and response are international endeavors. And as Dr. Nakatani so memorably just said, no country can address these access challenges alone. It is only by working collaboratively together that we can hope to achieve what we need to find those future investments for a healthy and a secure decade ahead. I thank you for your attention.
Thank you, Dr. Dame Angela McLean, for a valuable presentation. And next, we're honored to have with us next Dr. Chandresh Harjivan, Special Assistant to the President of the Office of Pandemic Preparedness and Response Policy from White House. Ladies and gentlemen, let's welcome him to the stage with a big round of applause.
Thank you so much for the opportunity to speak today. Thank you for Dr. Nakatani from WHO for her presentation as well. Today I'm going to talk about three things. I'm going to talk about local lessons learned. I'm going to talk about capabilities and response, and then I'm going to talk about supply chains. So the first, this conference here is about the world. It's global. It's also about the future. But let me start with looking at the past and looking locally here. So in Korea, in 1950, the lifespan was 53 years old. Today, it's 83 years old. That is a remarkable achievement, and I want to make sure that you all give a round of applause for the work that you did to achieve that remarkable achievement. We have to learn from Korea. The world should be coming to Korea, and we are coming to Korea today to understand what you did to have such a successful capability building in healthcare. Now, healthcare and economic development are intertwined, and I believe that the interventions that South Korea put in place helped with the economic development here as well. Korea did some pretty simple things. It looked at preventative care, and these are simple things like improving diet, smoking cessation, but also increasing access to rural clinics, and innovations like health insurance, paid for health insurance, creating the demand for healthcare. I think that's really important. So while we want to look to the future and we want to look globally, I think we need to take the opportunity to see what has happened here in Korea. I actually had the opportunity to speak to a few students from Korea earlier today, and they're focusing on health and climate change. And I think that's important as well. So you're not resting on your laurels. You are going to be a world leader in being able to build healthcare capacity, which allows us to respond to health threats as they occur. Which brings me to my second topic, response. So when we look at response, it's really about three things. It's about speed, scale, and flexibility. You know, over the past year at the White House, we've had to respond to numerous outbreaks. Things don't always have to be a pandemic. You know, first of all, we had to deal with the highly pathogenic avian influenza. We had to deal with Mpox. We had to deal with Marburg, and then we had a patient with Lassa just last week in the United States. In each of these cases, we had to use a framework of detect, develop, and deliver. Being able to detect diseases as they emerge quickly is so important. We need to have global diagnostics, global biosurveillance. An ounce of prevention is worth a pound of cure. The quicker we can identify diseases, it gives us time and space to be able to respond to them. That's the speed. Then we have to scale. Once we identify an emerging disease, we have to develop countermeasures to that disease as it emerges. Scaling requires a global response. Scaling is not one facility in one country, but it requires multiple facilities in multiple countries. We still have to embrace the multilateral view in responding to these global threats because these threats are global. And then there's flexibility. We don't know what diseases will emerge. We have to have an armamentarium of multiple things that we can respond to these threats as they emerge. I'll give you the example of Mpox, where we used smallpox vaccine that was able to be used. With HPAI, we looked at Tamiflu and other drugs that were used for flu. When we looked at Marburg, we had looked at developing new drugs and new therapeutics to it, but also the need for better diagnostics for that as well. And then when we look at Lassa fever, you know, we were at a loss. We had to look at old drugs that may or may not be useful. So we have to be able to, when we build these manufacturing capabilities, we are able to look at different products wherever they may be and to make sure that they can be effective, or reuse drugs or develop new ones. And then we have to look at the supply chains. Again, supply chains are international. We talk about developing mRNA vaccines in Africa, and that is very important. But often people in poor countries don't have access to high quality, routine antimicrobials, antibiotics, antivirals. We have to be able to ensure there's access to these simple medications which are so life-saving. If you look at the WHO essential drug list, there's shortages throughout that list. We have to make sure we bolster the capacity to provide these incredibly cheap and effective medications around the world. That means mapping the supply chain, diversifying the supply, ensuring there's demand for these products as well. Not just through donor aid, but through countries investing in their own healthcare systems as well. So through these three things, I think, you know, if we look at lessons learned locally here, capabilities and rapid response, and then supply chains, I think we make a big difference throughout the healthcare system and also for pandemic preparedness and response. Thank you so much.
Thank you very much for those meaningful words. Thank you. And ladies and gentlemen, it is my great honor to now welcome Dr. Junetong Pilife, Executive Director of United, to the stage for his presentation. Let us welcome him with a warm round of applause.
Your Excellency Minister Cho, Your Excellencies, distinguished guests, dear colleague, dear friends, good afternoon. Thanks also for Dr. Nakatani to have co-organized with the government of Korea this edition of the Bioforum. I'm very glad to be here today because I was there 2 years ago for the first Bioforum, and I was really impressed by the launch of this initiative with the President of the Republic of Korea, the vision from the public health, but also the political leadership. And I'm really glad to see that not only last year, but this year, we continue to support this initiative. I want also to thank the Republic of Korea for the constant support that we receive as UNITED, as an organization, since now 16 years. As you know, UNITED is really focused on access to innovation, and of course, it was said before, Korea is the country of innovation. Just see the big screen behind me. I've never seen a big screen like that, except the one I saw this morning at the airport. But of course, here in this country is the #1 of biosimilar, and we really think that biological products are part of the future of the response in public health. As UNITED, we think that access to innovation is about people. And every year, we support access to innovation for more than 300 million of people, in particular, people living with HIV, TB, malaria, but women and children, and also fighting for PPPR. I will come back to that. It's important to have the right product, but also to use the right product at the right level. And decentralization and simplification is key. If you give the right product to even the people themselves, you can achieve a lot of progress in terms of public health. The partnership, I think it's one of the reasons we are so happy to be here today. Yes, with the academia, the industry of the Republic of Korea. But of course, we will have a session tomorrow with KDCA to host a side session and to be more focused on what are the challenges we see in terms of access to biologic and the importance it can have. So really working with also the right foundation, it's very important for us to get the connection from the academia, from the civil society and industry and the government. Just want to end with the pandemic situation and the pandemic risk that we are facing. It was said by McLean, and we are part of the 100 Days mission, and it was also mentioned by our colleague from the US. We had agreed, not just UNITED, but also WHO and other organizations, on 8 viral families of virus that have a risk of creating a pandemic situation. Let's be honest, none of the 8, including what you said about Mpox or Marburg, have any therapeutic that works. And I think that unfortunately we have seen during COVID-19 that repurposed drug may be a good idea, but it didn't work. So I urge really all of us, to contribute to create a coalition for R&D to fight against this family. We know that it is coming. It is coming in 5 years, in 10 years, in 20 years. And we need to act now. And part of the solution may also rely on developing the right biological product, in particular the MABs. Thank you for your attention.
Thank you very much for your words. And ladies and gentlemen, last but not least, please join me in welcoming Mr. Ricardo Baptista Leach, CEO of the Health AI, to the stage. Let us welcome him with a big round of applause.
Good afternoon, and thank you very much, Honorable Minister Cho, Honorable Ministers, Honorable Members of Parliament, Excellencies, colleagues, friends. It is a great honor for us as Health AI, the Global Agency for Responsible Artificial Intelligence in Health, to be here. We are very grateful to the Government of the Republic of Korea for having invited us to organize the first side session that happened this morning, precisely on the topic of governance of responsible AI in the field of health, and to be able to comment on the very impressive keynote address by Dr. Nakatani. We would like to present our comments here today as Health AI from a perspective of artificial intelligence in the field of health and how that correlates with many of the biological threats and challenges that we face when we look at the regulatory environment. Dr. Nakatani presented the focus on global regulatory strengthening. This is something that we see as critical when we talk about artificial intelligence in health. Our mission as a nonprofit is working with governments precisely to build that regulatory capacity so that governments can be capable of assessing and making sure that the technologies that are deployed into health systems are not only quality assured, but they're also effective and they're also safe, making sure that we are putting citizen safety first. This is a critical element to scale technologies, to accelerate that technologies that work reach the people, and that these technologies can be used to transform the currently disease-driven health systems of today towards health systems focusing more on prevention, on well-being, on quality of life. Using the power of AI, we need to collectively redesign and rethink how we can make sure that we lower that burden of disease so that people can live longer, happier, and healthier lives. But it was also mentioned in Dr. Nakatani's presentation, the challenges when it comes to regulatory capacity, particularly for emerging technologies. We are seeing the same thing. In many countries around the world, despite having so many guidelines and standards, many countries do not have the regulatory capacity that is needed to address the rising requests from the private industries when it comes to the application of artificial intelligence. And it's so important to have some level of global alignment when it comes to the principles of responsible artificial intelligence to make sure that we avoid even further fragmentation that ultimately will slow down the adoption of these technologies that can help us transform health systems for the better. It was also mentioned the issue of workforce training, with the example of the WHO Manufacturing Workforce Training Initiative. We at Health AI see this as a critical bottleneck. So we are aiming towards building that capacity through capacity building with governments to make sure that all stakeholders in each country have that minimum capacity so that they understand and are capable of applying the principles and standards and guidelines when it comes to responsible AI. But there was another issue that was mentioned in the presentation that I would like to highlight as probably one of the most critical. It is the issue of equity. We saw the many challenges throughout the pandemic that led to the rise of this Bio Summit, that equity is far from being a reality. The truth is artificial intelligence can be a tool towards which we move the world towards greater equity. But it also, if it is deployed incorrectly, if we do not build the right governance models, artificial intelligence can be the greatest divider of our times. Making sure that people who are in high-income countries benefit from the technologies, but also making sure that those in low-resource settings can benefit. Actually, it is precisely in the low-resource settings where many times there is no access to health or care that there is the biggest opportunity to embrace technology driven by artificial intelligence, to leap to a future where actually people in the most remote villages and towns of the world can have access finally to care that they do not have today. And it was also mentioned in the presentation of the importance of data-driven oversight and safety assurance. We see this as a critical element when it comes to artificial intelligence in health. We do not discuss enough the importance of post-market surveillance, of making sure that after the technology is deployed into health systems, that we are capable of having mechanisms in place that assess the technology with real-world evidence to make sure that if there is a problem, we can detect it early on. That is why Health AI is working with governments and regulators to build the global early warning system. So no matter where in the world there is a risk that is detected, all regulators are able to get a red flag to be able to act fast and to act first. Finally, the last slide that Dr. Nakatani showed us was about the need for multi-stakeholder collaboration. There is a book called Power and Progress that looks at the evolution of technologies over the last 1,000 years. Very rarely did these technologies actually lead to benefits to all of humanity. Every time the people developing the technology says that that technology was going to save society, but most of the time it led to a concentration of power and wealth. The few times that we were successful as humans, as a society, to use technologies to transform the way health was delivered and the way society was transformed was when everyone, every stakeholder was included in the process from the beginning. And that is why Health AI has launched a community of practice that joins governments and regulators, academia, civil society movements such as patient organizations, but also the private sector, so that everyone can come together, so together we can co-create that future. We can co-create the governance model that will make sure that artificial intelligence benefits everyone, and that we can use the power of technology to ensure health for all. Thank you very much.
We'd like to extend our sincere gratitude to all the keynote presenters. Thank you. And this brings us to the end of the opening ceremony and the keynote speech. Ladies and gentlemen, please note that the first session of the World Bio Summit 2024 will begin here at the Grand Ballroom starting from 3:30 p.m. So ladies and gentlemen, if you want to join other sessions, please check the program first and proceed to the respect session halls. And we'd like to welcome you back at this hall for the first main session at 3:30. Thank you very much for your participation. Your Excellencies, distinguished guests, and ladies and gentlemen, welcome back to the World Bio Summit 2024. And now let us begin the first main session. And before we begin, we'd like to extend our sincere gratitude to all of you, both online and offline, for joining us today at this meaningful gathering. And the session offers a simultaneous interpretation service from Korean to English and vice versa. So for those who are joining us here at the site, please use your receivers on your tables. Channel 2 is for English. 네, 시작 전에 동시통역 서비스 안내 먼저 드리겠습니다. 오늘 현장에 계신 분들께서는 동시통역 서비스 한국어와 영어로 청취하실 수 있는데요. 오늘 국내 참석자분들께서는 1번으로 설정해 주시면 한국어 통역이 가능합니다. 유익한 시간 되시길 바라겠습니다. Thank you. Please use your receivers once again for channel 2 is English. Thank you. And this first main session has been organized under the theme of targeted, transformative, and trailblazing breakthroughs. And at this session, we will share the importance and implementation strategies of innovative and challenging R&D in the field of healthcare. And this session will examine the growing need for national approaches to R&D to tackle complex issues in healthcare and discuss the necessity of international cooperation to address global challenges. We ask for your continued interest until the very end, and I hope that this session will serve as a meaningful opportunity and a platform to explore new solutions. Thank you. Then now we will begin the opening remarks and words of congratulations for this session. First and foremost, please join me in welcoming Dr. Son Kyung, Director General of the K-Health Media Initiative, to the stage to deliver his opening remarks. Please welcome him.
네, 안녕하십니까. K-헬스 미래 추진단장 맡고 있는 선경입니다. 먼저 이렇게 오늘 주제인 미래를 바꿀 선도 혁신 기술의 집중적인 육성이라는 컨퍼런스에 참석해 주신 최선 첨단바이오 비서관님, 그리고 차순도 보건산업진흥원장님, 그리고 왕규창 대한민국 의학한림원 원장님께 진심으로 감사를 드립니다. 또한 바쁘신 일정 중에도 발표와 토론에 참여해 주시는 앙드레 로즈크루크 피에트리 EU 제다이 의장님과 패트릭 로즈 독일의 스프린디 이노베이션 매니저님, 그리고 디테 렌데 바이서 덴마크 ICDK 서울 센터장님들을 비롯한 이 자리에 함께 해주신 모든 분들께 감사와 환영의 말씀을 드립니다. 올해 열리는 2024년 세계 바이오 서밋은 안전하고 건강한 향후 10년을 위한 미래 투자라는 주제로 팬데믹 시대 이후에 혁신적인 연구개발 및 안정적인 글로벌 공급망 구축의 필요성을 고찰을 하고 바이오헬스 분야의 글로벌 협력 방안을 논의하는 자리로 마련되었습니다. 특히 연구개발 분야는 최근 세계적으로 기술 경쟁이 심화되고 있습니다. 따라서 주도권 확보를 위해서 도전적이고 혁신적인 연구개발에 과감한 투자를 위해 통해서 선도적인 지위를 유지하고 기술 격차를 확대하는 노력을 가속화하고 있습니다. 이러한 치열한 경쟁 속에서 진흥원과 복지부는 한국형 아르파-H 프로젝트를 추진을 하면서 기점으로 해요. 지금까지의 연구개발 방식을 과감하게 개선하고 바이오헬스 분야의 국가 난제를 해결할 임무 중심형 사업을 추진하고자 합니다. 특히 죽음의 계곡이 넓고 깊게 존재하는 바이오헬스 산업의 특성상 본 사업의 목표는 이미 완성도를 갖춘 기술을 죽음의 계곡을 통해 구체적인 성과물을 국민들이 체감할 수 있도록 하는 데 있습니다. 다시 말해서 도전적인 목표를 설정을 하고 그것을 달성할 방법을 찾아가는 과정에서 혁신적인 기술 개발뿐만이 아니라 죽음의 계곡을 넘기는 혁신적인 노력을 포함해야 되는 과제인 것입니다. 이러한 과감한 도전을 통해 대규모 팬데믹과 미정복 질환 극복을 통해서 안보를 확보하고 국민 건강에 큰 영향을 주는 초격차 바이오헬스 기술의 개발 체계를 단계적으로 완성해 나갈 것입니다. 이와 관련해서 도전 혁신 연구 베라에 국가별 접근 방식을 공유하고 국제 협력 방안을 모색하는 이번 컨퍼런스의 주제는 매우 시의적절하다고 할 수 있겠습니다. 금일 내실 있는 논의를 통해서 도전 혁신형 연구개발의 이해도를 높이고 더 나아가 동 분야의 새로운 도약을 이끌어낼 수 있는 의미 있는 자리가 되기를 기대합니다. 감사합니다.
Please show your appreciation with a big round of applause. Thank you, Mr. Son Young, for opening this session with your valuable remarks. Thank you. And now we'd like to welcome Dr. Choi Son, Secretary to the President for Bioscience and Biotechnology, to the stage for her remarks. Ladies and gentlemen, please join me in welcoming Dr. Choi Son to the stage.
Honorable dignitaries and esteemed guests, it's my great honor to welcome you all to the first session of the World BioSummit 2024. I extend my heartfelt gratitude to everyone present here for joining us today as we embark a shared journey to explore the frontiers of biotechnology innovation. As a Secretary to the President for Bioscience and Biotechnology, a position that was newly established last February, I'd like to convey the President's strong commitment to advancing innovative research and development. The government of the Republic of Korea has been committed to transforming the nation into a global leader in advanced biotechnology and been preparing for the emerging bioeconomy era by mobilizing the nationwide capabilities. Most notably, in December, the Presidential Bio Committee, called PBC, chaired directly by the President of the Republic of Korea, will be inaugurated. This committee will serve as the highest governing body for the biosector, acting as the control tower to coordinate and oversee national biopolicies. Encompassing the full biospectrum, life sciences, healthcare, foods, materials, chemicals, and energy, the Presidential Bio Committee will focus on synergistically linking the entire value chain from basic research to clinical trials and commercialization to strengthen our nation's bioindustrial competitiveness through strategic actions and initiatives. In addition, the PBC is committed to enhancing the national biosecurity capabilities, such as biological threat response and supply chain stabilization, while establishing a collaborative framework between the government, industry, and public sectors, and supporting international cooperation. Earlier this year, in April, the President announced the 3 game-changing initiatives for Korea's future, which included advanced biotechnology, along with AI, semiconductors, and quantum technologies. With this focus, we are accelerating R&D in various fields, such as new biopharmaceutical drugs, advanced therapeutics, and digital healthcare, as well as sustainable, eco-friendly biotech innovations, thereby solidifying Korea's position as a global biotech hub. Furthermore, we have unveiled a blueprint for forecasting digital bio, leveraging Korea's world-class IT expertise and high-quality biohealth data integrated with AI. Significant investments are being made in biomanufacturing innovations, including synthetic biology and biofoundries. Today, we will have a discussion on the theme of intensive fostering of pioneering technologies to shape the future. Earlier this year, we launched the Korean Alpha H project embarking on a full-scale journey to address the challenges facing humanity in healthcare, we firmly believe that international collaboration and shared efforts are essential to the success of these ambitious endeavors. I hope that today's discussions will provide a foundation for practical solutions to our shared goals, drawing on the collective wisdom and experience of all our global community. Once again, I express my deepest appreciation to all participants for your invaluable contributions to these important discussions, and I look forward to our shared progress toward our common goals. Thank you very much.
Please give a huge round of applause. Thank you, Dr. Che, for your unwavering commitment and leadership. Thank you once again. And next, it is with my absolute pleasure to invite Dr. Cha Sun-do, President of Korea Health Industry Development Institute. Ladies and gentlemen, please join me in welcoming him to the stage with a big round of applause.
여러분 안녕하십니까? 반갑습니다. 한국보건산업진흥원 원장 차순도입니다. 먼저 2024 세계 바이오 서밋의 문을 여는 첫 번째 세션으로 미래를 바꿀 선도혁신 기술의 집중적 육성 컨퍼런스에 참석해 주신 최선 첨단 바이오 비서관님, 그리고 왕규창 대한민국 의학한림원 원장님, 안드레 로제크루크 피에트리 제다이 회장님, 패트릭 로즈 독일 스프레인 D 혁신 매니저님, 그리고 디테르엔데 바이서 덴마크 ICDK 서울 지부 센터장님을 비롯한 많은 귀빈 여러분께 진심으로 감사의 말씀을 드립니다. 또한 이 오늘 행사를 준비해 주신 우리 성경 K 헬스밀의 추진 단장님을 비롯한 관계자 여러분에게도 감사의 말씀을 드립니다. 인류는 이 코로나19 위기로 새로운 문명을 시작했다 해도 과언이 아닐 정도로 건강에 대한 인식을 바꾸어 놓았습니다. 이 바이오 헬스 분야의 과학 기술은 국가 안보와 경제의 중추가 되었으며 국민의 건강과 삶의 질 개선에 직결되는 핵심 요소로서 그 중요성이 어느 때보다도 높아졌습니다. 이에 따라 미국, 영국, 일본 등 주요국들은 이 바이오 헬스 분야의 기술 패권을 선점하기 위해 대규모 투자 계획과 연구 개발 정책들을 추진하고 있습니다. 우리 또한 국가 차원의 미래 경쟁력과 기술 주권 확보의 열쇠로서 한국형 알파-H 프로젝트를 통해서 지금까지의 연구개발 방식을 과감하게 개선하고 설정된 5대 임무에 따라서 국가 난제를 해결할 임무 중심의 도전 혁신형 연구개발 사업을 추진하고 있습니다. 이 5대 임무는 첫 번째가 보건안보 확립이고, 두 번째가 미종복 질환 극복, 세 번째가 바이오 헬스 산업 혁신, 네 번째가 복지 돌봄 서비스 개선, 그리고 마지막 다섯 번째가 필수 의료 혁신입니다. 이러한 행보에 발맞춰서 주요국의 도전 혁신형 연구개발 분야의 추진 전략을 공유하고 국제 공조를 위해 협력 방안을 모색하는 이 오늘의 이 컨퍼런스는 새로운 연구개발 체계 전환으로의 본격 도약을 알리는 아주 의미 있는 자리가 될 것이라고 생각을 합니다. 귀한 시간을 내어 오늘 자리를 뜻깊게 만들어주신 모든 분께 다시 한번 감사의 말씀을 드리며 여기 계신 모든 분들의 건승을 기원합니다. 대단히 감사합니다.
Thank you. Thank you, Dr. Cha, for your warm words on the future of the bio industry. Thank you. Last but not least, we'd like to welcome Dr. Wang Kyu-chang, the President of the National Academy of Medicine of Korea, to give us his words of congratulations. Let us welcome him with a big hand.
Ladies and gentlemen, dear participants, I'm Dr. Wang, who is the president of the National Academy of Medicine of Korea, which is a similar organization to the National Academy of Medicine in the United States. It is my great honor and privilege to deliver a congratulatory remark at the World Bio Summit 2024, hosted by Ministry of Health and Welfare of Republic of Korea and the World Health Organization. World Bio Summit 2024 is a scientific meeting and a festival for all health and related societies of Korea, as well as for WHO and the leaders of public health in all the countries in the world. On behalf of all members of National Academy of Medicine of Korea, I would like to express my sincere gratitude to those who came to our country to attend this meeting. As all of you are well aware of, the COVID-19 pandemic taught us again that the issues of public health is a vital agenda in the aspect of national security, economy, and social stability. Transportation limitation, vaccine availability, and many difficulties during the pandemic brought international conflicts and competition, emphasizing necessity of international cooperation, harmonization, and solidarity against medical disaster and crisis. The role of moderation of WHO and devotion of the leading countries in the medical technology was highlighted in this critical period. Looking back the history of pandemics, the emergence of SARS, novel type influenza, MERS, and COVID-19 showed average 6-year intervals between pandemic episodes. When we think that the COVID-19 outbreak occurred in 2020, the next outbreak may come to us within a few years. Although this assumption does not have a scientific background, we may have only a few years to prepare the next pandemic before we encounter disease X. During this short remained interval period, international new normal and adequate code of conduct should be established, and medical technologies and public health policies should be advanced and refined with consideration of international and social inequity issues. I expect the World Bio Summit 2024 be another stepping stone for building international solidarity against the disease, disasters, as well as ordinary daily agenda in the public health among the lifeguards striving at the front lines of such a highly difficult but mandatory mission. Again, I would like to congratulate the World Bio Summit 2024 and welcome those who came to Korea to participate in this meeting. Please exchange updated information on public health, promote mutual cooperation, and refresh your friendship. And please enjoy beautiful scenery of Korea and warm hospitality of Korean people. Thank you for your attention.
Thank you, Dr. Wang. We appreciate your wisdom and commitment. Thank you. And ladies and gentlemen, before we move to the presentations of this first main session, we will now have a brief photo session. So we'd like to welcome our esteemed speakers. Please come up to the stage. And we'd like to also welcome our 4 presenters and 2 panelists and our moderator. We'd like to invite you up onto the stage and have this photo shoot together. 네, 본격적인 발표에 앞서서 조금 전 말씀을 전해주신 내빈 여러분과 잠시 후 말씀을 전해주실 4분의 발표자, 2분의 패널분들과 좌장님 저희가 무대로 모시고 기념사진 촬영하겠습니다. Please come up to the stage. Thank you for your valuable time. And ladies and gentlemen, please remain seated. We'll soon proceed to the first presentation. Thank you. And please make sure that we're at the center of the stage. Please follow the guidance of our staff members. Thank you for your valuable time and sharing your knowledge and wisdom at this first main session. And we believe now we're ready to take a photo shoot. We have a center camera up there. 네, 중앙 위쪽에 있는 카메라 봐주셔야 합니다. 활짝 웃어주시고요. Please make a huge smile towards the camera. And for the next photo shoot, can we do a cheer up pose as we did at the opening ceremony with your right hand? 오른손으로 화이팅 한번 외치면서 사진 촬영하겠습니다. 네, World Bio Summit 화이팅! 앞쪽 카메라 보시죠. Please maintain your pose. And ladies and gentlemen, once again, please give a huge round of applause for the successful launching of this first main session. Thank you. And now please return to your seat. 자리로 다시 모시겠습니다. 네, 고맙습니다. Thank you for your patience. And now we will proceed to the first presentation. And please note that we will have 4 presentations. And after that, we will have a panel discussion. At the panel discussion, we'll be welcoming our 4 presenters back to the stage. And our 2 additional esteemed panelists will be joining us at this panel discussion. So ladies and gentlemen, please be with us until the very end of this first meaningful main session. And we're now ready to welcome our first presenter. It is my great honor to introduce our first presenter, Chairman of JEDI, André Roskrug-Pietre. And today he will be delivering his presentation under the topic of Disruptive Innovation for Global Health, Europe's Role in Shaping a DALFA-style R&D Ecosystem. Please welcome him with a big round of applause.
Good afternoon. When you see this kind of increase, this has nothing to do with data, with healthcare directly, but of data. And you see where we are. We are in 2024 still. We are just at the beginning of an exponential growth in data. You could use the same kind of chart for research papers and for so many things. So we can't continue funding and supporting research and innovation in the same way that we've done in the past, because we really entered an exponential age. So, like people do in the military, let me give you the first deliverables up front, the famous bluff. I'm going to give you a context why we do that in Europe, why we have decided to set up an initiative that really radically try to change innovation and technology development. Our views why the world of today is different, winner takes all, it's exponential, and it's really a world of big bets. So I really commend what Dr. Wang, Dr. Cha, Dr. Sun just mentioned to us, is the creation in Korea of a ARPA type of organization. I'm going to dive a little bit into our life sciences program, and then, as I think there's a lot of interest here, to give you some lessons learned for the past 36 months of what we've done, achieved, and some lessons learned from Europe. So what we do, we finance advanced research programs. So we don't finance startups. We finance topics which are too risky and too long-term for the private sector, the so-called moonshots. The specificity of JEDI is that we spend half of our time in trying to understand what are the topics, what are the disruptions, what are the potential crises, but also opportunities of the next 3 to 10 years. We don't do science fiction, but we also try to go beyond the immediate pressing needs. And we spend 50% of our time on this scientific and technology foresight, and more than 6,000 people all over Europe are involved in that. And then we launch our program, which is our core activity, and I will tell you a little bit more how we do this. So key facts and figures, we have 5 active programs right now. We have 40 different streams. A third are around life sciences, I think what is key for us here. A third is around computing, AI, quantum, cyber, and so on. And a third are around energy and environment. We are not a centralized structure. We try to have a very decentralized structure in Europe. We include hubs in the UK, in Switzerland, in Norway, so it's not just about the EU. And we have many partners, and I want to highlight in particular our partnership we have with IVI in Korea. The context. I will go very quickly because this is a more European-centric view, but the power is shifting. Just to give you this very incredible slide is today the top 40 largest French companies, and it's actually worse for the top 40 largest German companies, are worth less than one single company, Microsoft. In Europe, we're very proud of our research and technology ecosystem, but the technological dependency, and I think one of the speakers before talked about sovereignty, we have basically lost our technological sovereignty. Some people call me a pessimist. I just think that in order to take the right decisions, you need to be a realist. I won't go into the details of all that, but I think the numbers are pretty telling. Often you hear we don't have technology giants, but we have great research. Even on the research part, I would call it code red. If you take what I think is the most important factor is the top 1% cited papers, the ranking of European countries are all going down. UK, Germany, France in particular, and you see obviously the rise of China in this context. So this is basically the European perspective, why we need to do something which is not baby steps, but with a radically different approach to research and technology. First, we're in a world where the winner takes increasingly all. And this actually is a glimpse of hope. That means that you can reshuffle the cards. Obviously, I show the market shares on cloud, but I could say the same about OpenAI. In October 2022, OpenAI just made suddenly keyword search by Google relatively obsolete. So suddenly you can reshuffle the cards, not by trying to catch up, but invent the next big thing. That's why this radical innovation is so important. We also could talk about the fact that we're an increasingly interdisciplinary world. We all know that. Everybody, every speech mentions interdisciplinarity, but we also know that we're in an increasingly deep world where you need to be extremely specialized. And it's very difficult to actually work across disciplines. It's not valued by a peer review. It's difficult to be valued in traditional institutes. And I cite these 2 examples. I could add DeepMind to that. Is NVIDIA a software or hardware company with CUDA? Is Tesla a software or automotive industry? Is DeepMind an AI or biomedical company? Very telling that the Nobel Prize in Chemistry was attributed to, just a couple of weeks ago, to two out of the 3 were researchers from DeepMind. We are in this era of big bets. I mentioned about DeepMind. I could talk about the automotive sector. While BYD is currently wreaking havoc in the European auto industry, and obviously how players like DeepMind are becoming key players in the pharma industry. So let me do a little deep dive on some of our programs. And I will try to highlight a couple of them. We always start, and I think another very good, I think it was the assistant to the president who mentioned very rightfully, we need to be able to convey to our people, our citizens, what we do. At JEDI, we don't do science for science or technology for technology. It's always a very purpose-driven approach that we convey. I mean, despite being European, I think nobody has embodied that as good as Kennedy when in '62 he did his famous moonshot speech at Rice University. He used this word, we choose to go to the moon, so it's a voluntary approach. He made a very clear goal. By the end of the decade, we will bring somebody to the moon and bring him back safely, him or her back safely. And he didn't do that in front of a, I would say, elite room. It was in a football stadium, and the 40,000 people really felt empowered. And along the 7 years that followed, you had thousands of research programs in propulsion and material and healthcare that were developed with this single, very clear and very bold vision, which the advisors of the president had no idea how they would make it happen when the speech was done. So you need to think big, but think that it's realistic. So one of the issues we see today is the explosion of cancer with young people. Some recent papers show that people born after 1990, and I don't want to scare anybody in this room, have close to twice as much risks of having cancer than those born before. Is it because of the diet? Is it because of our lifestyle? It's not really completely clear, but this is a topic where we need to have radically different approaches. We have a program right now which is kind of building on the vast research that has come from the ocean microbiome. Let's not forget, oceans have developed life forms much earlier than on Earth, and only 2 or 3% of viruses, bacteria, and genotype have been sequenced so far. So it's a huge potential to develop new therapeutics. We have a topic which is closer to synthetic biology, which is in the agricultural field, which is about plants developing their own fertilizers. We have, obviously, a program which I did not mention here, but I think is absolutely critical for life sciences, is what we call confidential computing. Can we do big data analysis by guaranteeing, by design, that you don't go back to individual data? You imagine today, we don't want necessarily to merge all our databases because of privacy issues, etc., at least not, I would say, in the democratic world. And this is a limitation. This is a limitation, obviously, in healthcare, but it's a limitation in mobility, it's a limitation in many in security and defense, obviously. So areas like confidential computing, federated learning, homomorphic encryptions are the right way to probably tackle that problem that could be a total game changer. We are working based on our first program, which was on developing new therapeutics with AI. We are trying to have a prediction of the type of variants that can come. So you can imagine what kind of impact that could have on pandemic preparedness. On AMR, the program is not launched yet, but we're thinking of launching a program trying at least to distinguish very quickly through a test if we're talking about a bacterial or a virus type of infection, removing 2/3 of the use of antibiotics, which are often used in viral affections. And I saw with great interest that the ARPA-H initiative by Korea is also thinking about something about having a much more room temperature cold chain management of RNA vaccines. I think this is a very promising field. I won't go too much into detail, but I'm very happy to detail some of the programs that we are launching. So let me spend the last couple of minutes I have to dig deeper into the methodology. The problem with ARPAs is you don't have an elevator pitch that you can give in 30 seconds. It's so much easier, and I talk very respectfully in front of the politicians in the room, to announce big funds, billions, etc. What really ARPA changed is the methodology, and that needs a little bit of explanation. First, it's interesting to see, and sorry to mention topics which are more dramatic like the Manhattan Project, but it's very interesting to see that increasingly radical discoveries, we all know from history there have been some wonderful accidents like penicillin, but increasingly the disruptions are happening through these structured programs that often bear these exciting names like Manhattan, like Apollo, or like warp speed. And sometimes it's hard for us to hear, but warp speed was done during the first Trump administration and basically helped in just a couple of months to bring RNA research to full-fledged vaccine manufacturing. So I think it's very interesting, and I think it's not studied enough what happened between March 15, 2020 and October when the first vaccines hit the shelves. Won't go too much into detail on that, but I mentioned to you about the anticipation. Just look on the left column what we missed. We missed, and I will talk about the world outside, especially of the US, we missed AI accelerators. And look at how NVIDIA is dominant today. We missed constellations, we missed autonomous cars, we missed drones. What we should not miss, and these are relatively clear on the horizon, now it's up to us to define more precisely where are the unlocks, where are the technological and scientific barriers, is obviously the promise of post-quantum cryptography, of fusion. It's telling that a lot of the entrepreneurs in the AI world are investing in fusion reactors. The topic of dependency to critical materials, which is so critical for our energy transition. And obviously the promise of synthetic biology, which hold this promise that we can move from an extractive focused world. You extract leather, you extract milk, you extract minerals, to a more generative, where we could potentially ask nature to do it and produce it through well-programmed proteins. So that is what we aim to do, and again, I'm inviting more the Korean ecosystem to join forces here. You probably have recalled who this person is. This is Machiavelli. Machiavelli at that time was living with a prince. It was a dictatorship, and he had this famous sentence, "You don't change structures, you create a radically new one, and the old structures will adapt." It is very hard to re-engineer. So we went very far. Not only did we create a new entity, but we also considered, and this is something to consider in the independence you will give to your own ARPA age, is that it's very difficult to be truly disruptive if you are within the government ways of funding. And I know one of the speakers after me will tell you how difficult it has been in a country like Germany. Let me go a little bit deeper into our approach, and I think that might be some lessons learned for some others. What do we see today in the traditional funding schemes? We talk about discovery research, and I think it's important to have curiosity research. We're talking about best efforts. We're talking about scientific and peer reviews, and I know it's going to be probably a bit provocative, but it's in order also to have a good debate. Peer review is increasingly, in some cases, toxic for true outliers. Just think about how difficult it has been for Katalin Karikó, that was this researcher who was the first who really developed RNA. For 15, 20 years, she was alone with difficulties to get funding, at Penn State. Obviously, now she's got the Nobel Prize, and the COVID pandemic changed everything. But the incredible thing that was mentioned to me is that today, if you do vaccines which are not RNA-based, you have, again, difficulties to get financing. So we seem to be repeating the same mistake again and again. We spray. We personally are advocating that the European research strategy is much more focused. The last program financed 38,000 programs. When you have financing 38,000 programs with an horizon, you don't have any priority, and it's very difficult to evaluate. We rather think it's important to focus. We think the name of the game is speed, even more importantly than money, so speed should be. And our real true KPI is not the process, is really, are we reaching out to the best brains? Do we have the best PIs? Do we have the best lab directors? Do we have the best chief scientists from startups of our industry who participate? That's why we have this decentralized structure, because we want to make sure that not only those who can write great grant applications, but truly the best brains are working on the same program. And we went very far, as I mentioned, to structure that as a foundation. And when we finance something, we don't try to pick the winner. We often finance 5 or 10 programs at the same time. So my final slide will be that. It's really a call for action. I felt a lot of will to cooperate and in the introductory speeches, so thank you for that. I really hope we can develop after these few days and these starting relationships here more joint programs. The difficulty is everybody has his own way of working, but I think we need to overcome that. I don't believe in a centralized approach, but I think that several like-minded agencies could really make a difference. Second thing, I think we are all looking for the best program managers, and I think on that one too, there's probably some cooperation, because I think the best brains, they want also diversity and having the possibility to work with the best, not only in Europe, not only in the US, but also in Asia. So I clearly invite more of Korean and international participants to join our foresight councils that we call moonshot councils, which really is our machine, is our factory to produce the programs that we launch. So we are both bottom-up in the way that people propose, but we also try to be top-down, but by using the ecosystem. It's like a good math problem. You never spend enough time asking the right question. And last but not least, we think this is definitely linked with future competitiveness. Research and innovation is at the core of the future of our societies. So we are going probably to establish these foresight aspect to really embody that in an institute which will be both research, technology, and competitiveness driven. Very happy to have Korea as a partner. Thank you very much, and I look forward to an exciting discussion.
Thank you very much for introducing EOS the Jedi. Thank you to Chairman. Thank you. And now it's time to welcome our next presenter to the stage. We're joined by Mr. Patrick Rose, Innovation Manager at Sprint. And today, the topic of his presentation will be Sprint's approach to R&D for breakthrough innovation. Let's welcome him to the stage with a warm round of applause.
Good afternoon, everybody, and thank you very much for the hosts for inviting me to participate and represent Sprint today at our conversation. I'm very excited to be here and talk to you a little bit about Sprint. It's a German company that is owned by the German government, and with a deliberate intent to allowing a company to drive innovation, supported 100% by the German government in allowing and empowering unconventional thinking, crazy ideas to really come to the forefront. So whereas my colleague just spoke about moonshots, we think more about loon shots, and we actually do pursue science fiction in terms of what we want to move forward. So Sprint is a company that invests in a couple of different programs that I'll talk to you about in a second. And our valley of death is before investment even is interested in it. So if you take anything away from my talk, what I would like you to remember is that in addition to a sense of urgency for driving new innovation, you should be less risk averse and take a lot of risk in trying new things, unconventional approaches that sometimes might seem a little crazy. And that's where we fit in. So we're looking for things that have no market viability at the moment, that have a high likelihood of failure. We celebrate failure in many different ways, but that has the potential for societal impact in our life today. So our investment thesis is really focused on providing solutions for societal problems to involve unconventional methods, and we empower those that are on the margins, on the edge, to come and to us with their ideas, whereas others might say that is too crazy or there's too much risk involved in that technology. And our other point to that is that we want to open new markets with these radical ideas. So as a company, we have the luxury of investing and investing fast and failing a lot. As a representative of the German government, we have the opportunity to be an activist as well, to really pursue and open new technology and technology markets. So I'm going to give you a couple of examples on how we think about things. But first and foremost, recognize, and this is our philosophy, is that today we see the world in a certain sense, but that is not acceptable to us. If we look at, for example, mRNA vaccines that were discovered in the 1990s, we're celebrating them now as a technology that did deliver us from the COVID pandemic. However, we're looking for the next technology, right? We're trying to develop new things that be able to reach the populations more effectively. And to that point, we have to sort of separate ourselves from what we know today and be open-minded about it and think about science fiction as to what is the potential? Where could we go? What have people discovered that might actually be interesting in new technologies that at the moment in the status quo or how we see convention might not be accepted. However, there might be a potential to do something quite exciting with it. And so there are three tenets that we try to pursue at Sprint in doing things. One is fail fast, celebrate failure because you learn more from failure than success, and enable thereby serendipity. So I call my team serendipity engineers because that accidental discovery that was just previously mentioned is really something that will drive truly radical new technology innovation. Second, be an agent for a change. Take an active role in saying, we will not settle for the convention or the status quo. We will not settle for technologies that are 30 years old as the status quo to save us from the next pandemic. We're looking for the next technology to move forward with. And second and third of all, recognize that this is a global community, and we certainly celebrate that the Republic of Korea is trying to pull everybody together and really make this a global effort. So let me give you a couple of examples on how we do this. As a company, we have two different ways of doing it. One is bottom-up, and the other one is top-down. The bottom-up is we act as an investor. So we will go around and look at individual companies. We are in the company creation business. We will go to academics who have a proof of concept, and then we will give them an opportunity and help them create these companies with their really radical, unconventional ideas. And we do that with an initial investment and a follow-on investment if we think there's real true potential behind it. The other way to do it is to do challenges, competitions. You've seen competitions all around. That's not necessarily very innovative. However, what we do is we really pursue those unconventional approaches. We'd rather not regret not having tried something rather than accepting the status quo as the way things work. So for the challenges, these are some of the challenges that we've already engaged in over the past couple years, including broad-spectrum antivirals, which I'll talk about in a minute, circular biomanufacturing, really trying to deliver that fourth industrial revolution in terms of being able to turn waste into a feedstock for microbes and produce anything you want. So talking about science fiction, we're really dreaming about building that Star Trek replicator through biomanufacturing, for example, or looking at tissue engineering as another technology capability. These are some examples on the other side, on their investment portfolio. So we're enabling a lot of different technologies, from laser-induced fusion all the way to biochips, fighting Alzheimer's disease and curing cancers. So the spectrum is very large in how we engage and pursue new technologies, but the core of it is still unconventional thinking, crazy or edge ideas that otherwise people don't necessarily think is something is possible. And we're willing to take that risk and fail and learn about the technology and where it might go into the future. The tools that we use are many, but one that sets us apart from everything else is highlighted in red. But let me talk about the others first. So we start all of our investments with a validation project, which is much like our version of due diligence. We will give a company or academics up to 220,000 euros and say, demonstrate the true potential of your technology, break the technology and see where its true potential is and the limits are. We can then subsequently follow up with a grant, with convertible loans, with equity investments, as well as pre-commercial procurement contracting. The difference that separates us apart from everybody else, and this is unique because we're a company, is that we can create subsidiaries. So we will pursue technologies and move these into a subsidiary that belongs to Sprint because the market is not ready for them. And so we can invest in them without the market pressure to really push them forward and then bring them into the market when they're ready, when they're more acceptable, whereas before they were considered as too risky or too unconventional. So let me give you a couple of explicit examples for these three tenets that we're talking about. The first one is fail fast, and enable serendipity. If we look at gene therapy and cell therapeutics, we have about 250 clinical trials ongoing at the moment, and currently the cost of these are about between $800 and $1.2 million per treatment. So we're looking for things that will challenge that convention and will most likely fail. However, they will hopefully evoke some kind of serendipity and discover something new. And I love the story about serendipity and serendipity engineers is because of stories like this where someone discovered by accident the microwave. And it was Percy Spencer who had a chocolate bar in his pocket who walked up to a microwave emitter and then noticed that his chocolate bar was melting. And voila, the discovery of the microwave came out that now is in every household. And it was a pure accidental discovery. And there are plenty more of those that exist at the moment. But you can only tease out those serendipity opportunities by challenging people to tackle the most difficult problems and look to fail in their endeavor to do it. So one of these examples that we're investing in at the moment is whereas gene and cell therapies right now take about 4 to 6 weeks, they have to go to central locations to be able to take the cells and amplify them and manipulate them. We're saying we want to try and deliver this at the bedside in 4 to 6 hours at a fraction of the cost, thereby enabling everybody the access to gene and cell therapy anywhere in the world. So where we currently have dialysis as a system that you can get, we want to do the same for gene and cell therapy. So we're tackling a very difficult problem. Will we succeed? We'll see, but we believe in the vision and the spirit and the passion of these individuals to try to support them and see if it happens. If we fail, it's a good failure because we've tried something rather than regretting not having tried it in the first place. Being an agent for change. You have the decision on how you want to engage in the world. You can be passive about it. You can be an agent about it in moving things. You can accept that the world order is going to drive things forward, or you can decide you want to contribute to that world order. We at Sprint, we decide we want to be part of that world order, and we want to help facilitate the best possible outcome for society. And so we are going to be an agent for change. So recently we concluded the broad spectrum antivirals challenge where we said we wanted an antiviral that will be ready on day 1, not day 100 of the next pandemic. It is not sufficient to wait 100 days to be able to save the lives that were lost in that duration of time. And so we've challenged teams to come up with solutions for that. And here you can see a couple of those examples that have been delivered. So imagine a technology where you actually have a DNA origami cage that you have an inhaler, and before you get on a flight, for example, you can inhale these cages and be protected against any variant of COVID. Imagine you could engineer some CRISPR technology, regardless of what the viruses that you're going to be engaging with or exposed to, the days before, immediately after discovery. And so we pursued this, and we developed and delivered several companies that now have new capabilities that they're taking into clinical trials, where they will have a solution on day one and not on day 100. We think we can do better than day 100 in developing medical countermeasures. And in addition to really challenging technological innovation, we're also being an agent for change in terms of being an activist. So we're looking for opportunities to push these things forward. And as many already recognize, we're tired of talking about pandemics. We're tired of talking about vaccines. There's no investment anymore. Investors are tired about it as well. And so there's market failure. So we've been championing advanced market commitments, market-shaping tools that will allow these technologies to be available today, so that when the next pandemic occurs, and I agree with my colleagues that there will be one sooner rather than later, we will have these technologies available on the market and ready to go on day one. And so Sprint recently won a market accelerator competition out of the University of Chicago with our response and our design for a market-shaping tool to develop broad-spectrum antivirals ready on day one, agnostic to the disease that we will be facing. Recognizing that we want to be part of a global society and force multipliers. What I appreciate about the world, and certainly it's exciting for me for my first time to be in Korea, is to appreciate your unique perspective and your distinct approach to doing things. Wherever you are in the world, people will see the same thing differently from many different perspectives, and that is something that we should celebrate. You should take that opportunity for when we're trying to solve the same problem to allow people to come at it from different perspectives and to try to solve that problem. And then contribute to the overall goal, because only together can we be better in terms of how we're going to solve problems. And so we want to partner. I'm here to look for new partners. I'm here to develop new partnerships and collaborate. One example is that we just announced a new partnership with the U.S. National Science Foundation, where we're going to create a number of challenges, joint challenges. We're going to challenge the convention, the status quo, and say it's no longer sufficient to develop incremental improvements in technology. We're really driving things at the leading edge. And so all you people with your crazy ideas, with your unconventional approaches, come to us because we're interested in supporting you and allowing you to move forward. So when we think about technologies, we do think about science fiction, because science fiction is based on some aspect of science that has been discovered already, and it gives us an impression of where we can go with that technology. And so those opportunities, when we put it to people to really go to the limits, to tackle them, to accept failure and to celebrate failure, we can drive serendipity forward and really enact new changes moving forward. And so when we think about technologies, we're really trying to push that edge and figure out how we can do those things. One example that I'm happy to announce here, which is the first announcement, is that we're investing in the Danish company Sniper Biome. They're developing microbial gene therapies to tackle antimicrobial resistance. What they have discovered is a platform technology that allows them to develop a probiotic that can purge resistance genes out of the gut microbiome. So imagine now a technology that can be available all across the globe at an affordable price that will purge antimicrobial resistance genes so that we can repurpose and bring the existing antibiotics to the market again. And we at Sprint are very excited to be one of the investors in this new technology, where we're going to be contributing hopefully over 20 million euros over the next 5 years to really move this technology forward. So we accept that there are technologies out there that are very good at what they're doing. However, we don't accept that that is the continued way of moving forward. And so we're looking for these passionate individuals who are trying to take risk and take an unconventional approach. So imagine in the future that in yogurt, in a probiotic pill, you can take these resistance purging AMR treatment, and then follow up with antibiotics that currently are ineffective anymore. And we're willing to take that risk in such a technology and such a company because they've displayed the passion, they have that unconventional acceptance in how to solve the problem, and they're really driving this technology forward. With that, I wanted to thank you for your attention. I also wanted to just go back to the approach that we're thinking. We try to challenge the limits. We don't limit our challenges. We accept failure, and we celebrate failure because you learn more out of failure. Plus, you drive serendipity in moving that technology forward. And that's why we empower those who are unconventional thinkers in driving technology. So we're looking for partners to do this, and I encourage you not to be satisfied with the incremental improvements, but actually challenge people to think far, far outside of their comfort zone because they believe that technology, the solutions that they have might be even more exciting than we have today. Thank you very much for your time.
Thank you for sharing your knowledge and experience. And through his presentation, we've learned about the Germany's approach, Sprint. Thank you very much for your words. And it's time to welcome our third speaker of this session. Please join me in welcoming Ms. Dite Weisse, Executive Director at Innovation Center Denmark, and her presentation will be about Denmark's strategy to build a global innovation ecosystem in the biohealth sector. Please welcome her.
Good afternoon, everyone, and thank you for the invitation to come here today. I've personally already learned a lot. I was invited here to share a little bit about the Danish innovation centers and also why we are located here in Seoul. So to start off, we recently had a meeting with Samsung University that came into our offices, and they casually asked, how can you Danes be so innovative when you work so little? And we didn't take offense of that. And I have to say, living in Seoul and in Korea, I sometimes wonder that myself. But I also think that this question says a little bit about different perspectives on what is needed to foster innovativeness. And representing Denmark and Danish embassy here, the question is also, what is actually an innovative country? I'm sure you all know some of these graphs and indexes where countries are ranked towards each other based on available risk capital, startups, R&D, patents, etc. But I also think that each country's history and approach can be different. And perhaps you also know some of these narratives that are prevalent. For example, when we talk about Scandinavian countries, we often think about the flat hierarchies and the welfare society being one of the reasons why they are so willing to take risks. On the other hand, we also know this American dream and self-made man and private capital is another way of achieving great innovation. We've even seen some of the examples before, some of the companies here. Similarly, when Danes think about South Korea, we think about the miracle on Han River, we think about the R&D investments and the high education rate, etc. Israel could be their military history and situation, etc. So there are different stories and contexts that really drive countries to the story behind on why they're innovative. And just a few more words for those of you who don't know Denmark as well, of course. We're a small country just north of Germany in Scandinavia. And some of you might know Novo Nordisk, which is the largest Danish company currently. But when we look broadly about, as an observer, I've been observing Danish innovation and research communities for the past 25 years. One of the things that we always come back to in our own narrative is collaboration. So how industries are able to collaborate with each other within the value chains, across sectors, etc. This is always one of the shared answers that they come up with, why they have succeeded. Also, internationalization is part of the Danish DNA on how we see innovation. We simply are a small country, and we need to do solutions internationally. And finally, as I also touched upon, the feeling secure, that you'll always have this security net behind you. And I think that's also one of the stories about Denmark and innovation. But at the end of the day, even if we are different, I think it's important to remember that the aspiration for all innovation is really about this future fitness. It's about the world that we want to live, and that is about a healthier and wealthier population, companies that are competitive. It's about our natural resources, and it's also about safety and security. So being fit for the future is really what we are trying to do. And that is also bringing me to why we have the Danish Innovation Centers. Because we are actually part of Denmark's strategy for future fitness. And if you stay a little bit with this analogy of the fitness, I think there are three things when you want to get really fit. You should always try to train with someone that is better than yourself for growth. Try to be with someone you can learn something from. You should also try and focus on the large muscle groups, because that's while you get effect for the whole body. And then, of course, think of the body as a system. But let's come to that. Just very briefly about our governance. We are a joint venture between the Ministry of Science and Higher Education and the Ministry of Foreign Affairs. We are located in the embassies around the world. And the mission behind the Danish Innovation Centers is to elevate Danish science and innovation through collaboration with world-leading innovation ecosystems. And as the map shows here, we have 7 centers located around the world, including the one we have here in Seoul. And basically, the overall rationale is to place the centers where there's someone we can learn from. So we're basically here in Seoul because we can learn and take back knowledge. I've even left this in Danish on the left side of the slide, because this is the objective facts. So how do we present if a place is worth investing in with the Innovation Center? This is obviously to do with the innovation capacity in the country. And Korea is definitely one of the leading hotspots for innovation around the world. So there are some objective facts about a location. But there's also the intention, and I think that is very important. Our Innovation Center in Seoul was established in 2013, but since 2011, Korea and Denmark really stepped up the bilateral partnerships, co-founded the Partnerships for Growth, co-founded Green Global Growth Institute together, and there was a very strong momentum. And so it's important to say that it's not just the facts or the objective facts, it's also that there is a good relation and it's intentional on where we choose to make these investments. Again, strategy number 2, focus on the large muscles. We as an innovation center do not facilitate collaboration just in anything. We are mandated to work with 3 areas, which is the green transition, health and life science, and digitization. And as we've also seen today, these areas actually have a lot of interfaces across technologies. We see a lot of investments from life science partners into quantum technology, for example, and the whole biosciences are also affecting other industries. So these areas that we focus on is, of course, because we want most effect. We believe that these are the areas that are going to drive future fitness, are going to drive future growth. So what do we actually collaborate with Korea on? So if we look to some of the areas, this, again, we have an 11-year history here. But if we look to some of the areas that are very active between Korea and Denmark, it's areas like robotics and AI. It's the hydrogen area, Power to X. It's health and life science, biotech, and quantum. So these are the areas that are active in terms of projects, networks, alliances, collaborations with universities, companies, etc. Because this is exactly another point about the innovation centers. I know we're talking cutting-edge research today. Our philosophy and the way we work is inspired by this MIT star to remind that we need many different stakeholders, that innovation can start with the groundbreaking discovery and research, but that the commercialization is also important, that the uptake is important. We can have extremely good healthcare technology, but if the hospitals and the sectors are not using it, it's not really getting out to the people or getting to the impact. So this is important for us. This is the way we consciously try to work and shape projects. And yeah, these are just a few examples on some of the activities that have been this year, to say that a lot of this starts with groups meeting. This starts with making people aware that each of the countries exist, creating good and inspiring meetings between them, and then making sure we follow up so that they actually take action on these good relations. And surprisingly, this is where a lot of our value add is actually at, is not just in facilitating the travel program, it's actually being the feet in the street after people come home and they have jet lag, etc., and make sure that we continue the collaboration. Again, our role and value add, we are part of the embassy, but we are 8 people dedicated to working in the Innovation Center with the projects. And that's a combination of Korean colleagues and Danish colleagues working together. Now, what we do is everything from making sure that the bilateral agreements between the ministers of science become an action plan, so supporting a strategic dialogue, but also, as I said, creating the awareness and visibility. What are some of the opportunities available in Korea? What is inbound programs for the startups? What are some of the funding mechanisms or the new projects going on? That's not always obvious to Danish audiences. The active facilitation and connection is, as I said, setting up the meetings, connecting people that might want to do, are looking for research partners, or we try to make the connections with our network and presence here. Importantly also, we help to find, identify funding, for example, because that's a driver of a lot of the innovation collaboration. And put plainly, we just try to make it easier and more attractive to collaborate between Korea and Denmark. And that can mean many things. So is it worth it? Because I think that was the other part of the question I got from Kitty. What is the impact that this actually has on the Danish innovation ecosystem? Yes, it is an investment. We have been 11 years here in Seoul, and there has been some time to calibrate a little bit on what are the topics, who are the partners. But I can say one thing, and that is that the interest is going up. And we see that from universities as well as from companies. So the trend is upgoing. We also usually see ourselves as this bridge, and a bridge does make sense because there are large gaps between Korea and Denmark in terms of market, in terms of network, in terms of funding mechanisms, news, etc. We have once in a while an evaluation of our centers, and our clients confirm that there is definitely an additional value to that. And that is the reason, of course, that the Danish government chooses to invest in having these dedicated offices. If we look at the outlook, I think it's been a little bit touched upon with the tech race, the strategic autonomy, technological dependencies. There is a tendency in the policies, also the Danish, but also broader, that international partners are being more carefully curated in today. And we see this especially on some technology areas where we, as centers, have restrictions. There are areas that we do not collaborate with our centers in China about today, whereas Korea is on the positive list for areas like quantum and biotech, etc. So we think it also makes sense to have this strong relation when we think about the type of innovation and the type of technologies that are needed in the future. Also, we are very excited to see that Korea will be fully affiliated to the Horizon Europe, Pillar 2, from January 2025. We also are looking forward to see what this could bring, but it definitely is a game changer in the sense that it brings a whole new type of joint financing on both sides. And that's actually what I wanted to say. My closing statement here is to say that what is very important with the bridge is that it goes both ways. And that means that we as a center are also very open to speaking and interested in networking with all Korean entities and institutions that have an interest or maybe a practical need to be connected to someone in Denmark. So the bridge goes both ways, and I hope you will contact us if you have any questions or interest. Thank you.
Thank you very much for your valuable presentation, and thank you for walking us through Denmark's strategy to build a global innovation ecosystem in the biohealth sector. Thank you. And it's time to welcome our last presenter of this session. On the topic of Alpha-style R&D strategy for Korean health security, we're joined by Dr. Song Chang-mo, Director of a Mission PM Center of K-Health Media Initiative. Let us welcome him with a big round of applause.
Okay, I learned that I have only 15 minutes, so I have to speed up my presentation. I'm very honored to present Alpha-style R&D innovation strategy today. My presentation consists of brief history of a K-Health Media Initiative, and I'd like to share the lessons learned from DARPA BTO and ARPA-H. And also, I hope to figure out possible key success factors of the Korean high-risk, high-reward project, and followed by the conclusion. Okay, let me start with these 5 biomedical mission R&D areas. As you know, our president, Dr. Cha Sun-do, presented these 5 missions already. So let me skip this part. And then we have these 5 missions for high-risk, high-reward. And we have 9 years to achieve our goals with about $850 million US. Then our leader, Director General Dr. Sun Kyung, is operating 2 centers here. Actually, we have General Supporting Center and also Mission PM Center. I'm in charge of Mission PM Center. Actually, today I learned a lot from former presenters, through very insightful presentation. We learned on Moonshot project of JEDI and Sprint in Germany. And we try to work with AMED and ARPA-H as well as ARIA in UK. I'm very proud of introducing our colleague here. We have about 36 people, and we are bold mover or audacious mover and goal-oriented, and also risk-taking people. And also we have very hard-working 5 program managers here. Let me explain how we do it a little bit later. And then we have 7 R&Rs for PM, program managers. And then I'd like to just to show this, let's say, these figures from DARPA to show PM activities. As you see, we have the PM manager, DARPA PM manager right here. They spend about 3 days outside office, and they do find best experts, and they are just making a networking for international expert advisors and so on. And they do manage the project through go, no-go, like 3 steps. And then they also do some converging teams. And then I'm kind of office director. So we work together very closely to achieve goals. And secondly, we've been using Dimensions AI. I learned that the ARPA-H in the US is really, the PMs are really required to use Dimensions AI to do big data analysis, to share global ranking of research topics, competing research groups, and so on. Actually, we are going to visit ARPA-H this coming Friday. We'll have a whole day meeting with the ARPA-H PMs and CETA staffs. And then, okay, I'd like to share, I'd like to just to show you some lessons from DARPA BTO and ARPA-H. As you see, this is a really good illustration of breakthrough technologies from DARPA's mission lasted 66 years. Just so I'd like to point out that in 2014, they invented this messenger RNA vaccine. It was invented by this person, Dan Wattendorf, who was DARPA PM at the time. As you know, they didn't have any BTO yet. So he was a PM at the DSO, and then he achieved this kind of a big success. And then also Madonna snakes 25 million DARPA grant to fight pandemics with the messenger RNA. So they became a star company in Boston area. So this is what the PMs are doing in BTO. So also here we have BTO at the left side. And then especially, okay, let me see. So let me just explain how ARPA-H was initiated. And I came across to reading this Expanding DARPA's Model of Innovation for Biopharma by Professor Mazzucato in 2022. And then I learned that Mazzucato and others called for similar entity like BTO in DARPA, and they called it HARPA. Then it was renamed ARPA-H by Jeffrey Ling. He was the founder of this BTO. So this is the kind of history, and Professor Mazzucato kept working on this. I believe she set up a really good roadmap for ARPA-H. And then she suggested we need extended pipeline model of innovation like DARPA does. And then we have to do mission-oriented approach to fill gaps in biomedical innovation. Then we need radical innovation. And we have to give funding for radical innovation and so on. And then interesting enough, if you look at the bottom part, ARPA-H actually did the disease research and new technologies. Now, they are interested in biomanufacturing. Actually, they contacted us last week. They tried to work with the Korean biomanufacturing. So we try to help them how to organize the funding and policy and so on. And okay, also I was reading this mission economy. Actually, when you read this mission economy, it is nothing but DARPA philosophy and moonshot and SDGs, Sustainable Development Goals. So that's how Marina Mazzucato became a really big person in this area. So she was talking about government type funding and innovation. And Dr. Sun Kyung pointed out this big problem in Death Valley here. And also Mazzucato said, well, we have to know how to manage Death Valley in biomedical R&D. And she suggested, number 1, we have to incorporate extended pipeline model of innovation. Number 2, we have to take a mission-oriented approach. And this approach could help direct resources and attention to critical areas through funding. So funding, actually money talks. And then we need founder-ethical innovation. So we have to have our own Korean-style breakthrough or policies to overcome this value of death. That's our big homework later. And then I'd like to just share one BTO PM right here, Catherine Campbell. Actually, we are going to meet her this Thursday. We are going to attend this DARPA Connect together. We are going to see about 10 PMs, DARPA PMs in one day. And also we learn a lot about their management style and many things. So we need a lot of international collaboration. As you know, we are only 7 months old. So we have to learn a lot. And then, as you see, Rune was a member of CETA, TechCETA, and then she became PM at DARPA, and then she became a director of ARPA-H with help of this Atia. Atia is the head of OSDP in Biden's administration. So as you see, they have 66 years experience and history in the US, but we have only 7 months in Korea. So we have to work very hard, and we need a lot of help from outside of Korea. And then I borrowed this slide from ARPA-H. I'd like to point out this Hail Mary Catechism and also PM, CEO. But I'd like to emphasize the advanced state of art. We are not doing 30% improvement. We try to do 10 times result, And also, we need to de-risk investment. So that's what we are doing next 9 years. So I'd like to find out how key success factor is. We are learning this book. We translate this DARPA model of transformative technologies, and also I introduced MIT Open Courseware. So we now have a good theory about these DARPA activities and so on. And then let me show just a 2-minute video right now.
Mentioned was the program managers, their autonomy, their individualism, their adventurism. We need people like that, and I'll make a point, which is that most countries don't allow such people, don't enable such people to have a venue to succeed. I mentioned the Japanese, I mentioned the Koreans. There are certain societies that are very structural, hierarchical, and are based upon, if you will, consensus orientation, and that's really true in many of the science worlds. Finding people who can go out the way the program managers do is crucial. And in fact, when we were talking to some people, Bill and Pat and I, in Japan about their notion of a DARPA, we presented them this notion of the independent gunslinger, if you will, program manager. One of the young Japanese science technology guys came up to me and said, "Oh no, we could never do that here." Just an example. I was in India talking about these ideas. Very much the same concern. Oh, we can't do that here. So until you break that notion of allowing people to have that level of independence and take on the responsibility, the individual responsibility for that program, not have someone else to blame, not have an organization to blame, if you will, if you don't succeed. And by the way, not succeeding in DARPA isn't a bad thing. You're not punished for not succeeding. You're congratulated for trying to take something on. You did a great job. Too bad it didn't work out. In fact, the program manager who did that space program, the Distributed Space Program, was given another program on advanced manufacturing, which he took on subsequently. So that's crucially important. And Pat mentioned the portfolio approach. DARPA doesn't just fund one organization or one person. In fact, they award multiple projects, some based on little seedling ideas, some on a broader concept, and they are, in fact, competing with each other. And they are then told they have to interact with each other. So,
okay, let me point out just a couple of things right here. He said PM system is not possible in India, Korea, and Japan. So we have to make impossible possible. Okay, that's the first task. Number two, we have to allow failure, but we are not. Our success rate is 98% in public R&D in Korea. So we have a big challenge. So I had a kind of R&D innovation conference with this Vice President, Sheriff's Weizmann Institute of Science. He said, the secret of the success in science and technology in Israel, he said, we hire excellent scientists and then let them give opportunity to take risk. So then they could fail. So he said, in conclusion, we have to tolerate failures, we have to analyze failures. So we have to follow this kind of R&D culture in Korea. And then luckily, we had this kind of success rate. I don't have time, so let me just move on. So let me finalize my talk with a few slides now. I would say failure is a success. In Silicon Valley, fail fast, fail often, fail first. Then we have to set up some kind of conference like falling wall in Berlin, and also at SpaceX, making mistake is a choice. But I like this most. Researchers or scientists who are unable to fail will never achieve great success. So if you don't fail, you are a scientist, you are an engineer. And then this book, I love this book because it says we have only success rate 2% from Empire State Building. He is a professor in Oxford from Denmark. So just we have to understand how to manage our big project, humongous project. And then I like this part because he said in his book, we have to look through from the right to left, not from left to right. That is exactly the same as DARPA's end game approach. We have to set up the goal, target, and we set a product, and we find the right research teams. Then, like this, we collect investors and try something where we have a world-known high, top-notch result. Then we cannot commercialize because that's not working anymore. It's an endangered species. So also we need important idea validation. Just I'd like to point out, we have to do prototype research first. And then we try big investment. And then this is my conclusion. So from our conference today, we learned a lot from JEDI and Sprint and also DIC. Then I say, well, we are only 7 years old, 7 months old. So our attitude is to focus on ambitious, mission-oriented goals. So far, we have 10 projects to be launched at the end of this year. Each project has about $15 million. Our PM, one PM has about $42 million for 3 years. So he's rich, but he is very responsible. So he has to fail first, and then we think we have only 15% success rate. So we have to tolerate risk and failure. And lastly, we need a lot of global collaboration like you, and then we'll work with you, and we'll go to your place too. Thank you very much for your attention.
Thank you very much for your presentation. Thank you. And we had 4 presentations at this session, and we shared our views on national approaches to high-risk, high-reward research and development in healthcare, such as the EU's JEDI and Denmark's Innovation Center and Germany's Sprint, as well as Korea's K-Health Future Task Force. And based on these 4 presentations, we will explore how disruptive innovations can cross the death valley and bring about transformations in global healthcare and medical services, while discussing strategies for international cooperation and collaboration to foster such innovations. And ladies and gentlemen, after a brief preparation, we will move on to the panel discussion. So until then, please remain seated. Thank you very much for your cooperation. Ladies and gentlemen, thank you very much for your patience. And as we welcome our moderator and our 4 presenters and 2 esteemed panelists to the stage, we have prepared an introductory video prepared by K-Health Media Initiative. So before we welcome our speakers to the stage, please draw your attention to the screen. Thank you very much. And we will now proceed with the panel discussion. And this panel discussion will be focusing on the importance of high-risk, high-reward projects for global healthcare innovation. Also explore collaborative approaches for international cooperation. As you can see, we're also joined by 4 esteemed speakers and 2 panelists and our moderator. And before we pass the microphone over to our moderator, please allow me to introduce him. So today, the discussion will be led by Dr. Hong Ki-jong, and he is the PM of the K-Health Media Initiative. And ladies and gentlemen, let's welcome our moderator with a big round of applause. You may have the floor.
Yeah, thank you for your introduction. Actually, I plan to introduce myself first, but she already introduced me, so let me introduce the panel member first briefly. And let's try to move to the discussion. First of all, Mr. Andre Rooskrug-Pietri, right? Rooskrug-Pietri from the JEDI. And the second, Dr. Patrick Rose from the German Sprint. And next, Ms. Director Ditte Weise from the Denmark ICD Innovative Center. And also we have 3 other Korean participant panel members, including the Dr. Chang Mo-sung, then Dr. Hani Kim, my old friend, and Dr. Yoon-hee Choi from the Korean Institute for Industrial Economics and Trade. Thanks for all of you to participating. Actually, let's move to the first issues to discuss about the panel discussion. So first issue which I want to talk with you is here the key factors of your institute or countries for enhance or enforce the innovative R&D system for future development. So from the JEDI, what is your empowered factor for the JEDI for future innovative R&D system? So can I hear?
What is your
empowered or remarked feature of your institute?
Well, we are structured as a foundation. That means that we have a capacity to be extremely agile and to focus entirely on 2 things. 1, asking the right questions. 2, actually 3 things. 2, being able to revisit these questions permanently, because as I mentioned in my presentation, the world is changing extremely fast. And by the way, I liked very much the presentation you did on ARPA-H, sir. The program managers are here for a limited period of time, not only to have some kind of a burning fire, but also because some topics need to be regularly revisited. So at JEDI, as well as at DARPA, and I wish it's the same in all other organizations, there's no such thing as, we already tried. I give an example which has nothing to do with life sciences, is drone swarms. If you talked about drone swarms 5 years ago, there was not computing power enough in any drone. Today has radically changed. A force for difficult topics, but also a force for good. Think about agriculture. So bold agility, program managers, and 3, this capacity to be extremely fast. I think we cannot stress enough that today speed is the name of the game.
Okay, thank you for your inaugural opinion for this discussion. So, Patrick, your sprint So you said Sprint has some kind of destructive concept for the future development. So would you talk about some kind of suggested concept for the new strategy to overcome the value of the death or some other kind of new feature?
Yes, so where the German government had the insight to create us as a company, which is quite an interesting model because we belong to the German government and we're funded 100% by the German government. However, we have the agility of a company to be able to react and operate very quickly. Our contracts are very minimal and very clear, and so it's easy to get through processes. And that allows us to address a lot of the things I just mentioned, right? So speed, trying many different things, being able to both spread the wealth, so through competitions as well as direct individual investments, actually try to make something happen. And then I think one of our largest strengths, which it's not easy, but it's possible, is to be able to create subsidiaries for technologies that will come to the market in the future, but either policy regulators don't know how to deal with them, or you have the market, the investors, the industry just not interested in that at the moment. But knowing that if they see that it's developing further, that through someone like Sprint, then they might become interested because it's been de-risked. And so we jump into this valley of death. That's not the same valley of death as you engage an investor, right? Investors want to see their profit returns within 5 years. And so that's a valley of death to be able to find the right investors to get in and convince them that you can become profitable. Whereas we jump in, there's a proof of concept. It doesn't fit into the convention of how things work. And that's where we really try to push the technology over that edge to then become the status quo or the convention. So we question everything that we have at the moment and then try to find alternatives.
Okay. So, Director Vice, so you already talked about the Danes' innovation as a natural characters, right? You already talked about the Danes' innovation characters for a long time. So would you talk about your idea for future innovation system in Denmark and Korea, also some of the kind of region in the world?
Hello? Yes. So again, we are part of a system that is really old. If we look at the embassies and the diplomacy. And the longest innovation center we've had is in Silicon Valley. And it obviously started with a focus on the digital, so the whole IT digital innovation, and because a lot of startups wanted to go get the venture funding in Silicon Valley. What we have found over these, totally 15 years is that each center and each location actually works differently. It's something that can be difficult for us to explain to our headquarters, that there's no one size fits all when it comes to how the centers should operate, what should be the business model, what is actually the strength. Korea is not an obvious market for Danish startups or SMEs. So what is much more important here and where we see the value add is in some of the strategic research agreements that we have. We have a lot of research excellence, a lot of interest from the universities. Now we see new opportunities because of the Horizon Europe. We don't know exactly what that's going to look like still, but it is a game changer because funding is very important when we talk about this bridge and this type of innovation that we're in. I would also like to just clarify around our business model that we actually we have income targets. So our KPIs is also income based. And that means that we charge large companies like Novo Nordisk. They cannot use the innovation center. They pay per hour for our services. So this is one way for us to make sure that we also demonstrate market relevance. We're in between the government strategy, do this, and then what does the market want? Which companies want to work with us and pay for the services? So I think we're going to stay in this, between science, diplomacy, and innovation consultancy, which we're really a combination. If my personal belief is that the way we see the innovation centers is that they're going even closer to the government. We see a lot of collaboration between the Science Ministry, Ministry of Defense, Ministry of Foreign Affairs, that these policies go together. So I actually think we're being pulled more into the strategic level, and we're going to be under more scrutiny on what type of things we support. But we also still really cherish the fact that we are those feet in the street that can make the small steps happen.
Okay, Dr. Song, these three European countries already has their own experience and philosophies and lots of the experiences. So what could be our Korean...
Actually, I'd like to save my time. I'd like to give them more time to speak, if you don't mind. Okay, because I gave a lecture already, so is that okay? Yeah,
oh,
it's okay.
Please, can I?
Yeah, because I gave a lecture,
Oh,
so
I see.
you know,
Sorry.
it's very it's not easy to listen, right?
Yeah, actually, what I hope to ask
I'm
him,
sorry.
him is about related to the KRPH's remarkable distinguished strategy, but maybe we already heard about the lots of features, so let's skip this turn. Actually, my plan is not to expand this question to the other members because I think it is related to some kind of institutional strategy. So let's move to the second question about the global collaboration or future demands of the institution. So this time, let's start with Dr. Che's opinion first. Yes. What could be our future demands or some kind of roles or functions of the global collaboration for innovative R&D system?
Okay. First of all, I'd like to thank you all the presentation, and all the presentation was very impressive for me. And today I really realized that the active innovation activities for high risk and high rewards projects around the world. So. For your question, I like to highlight that I could see some similarities in the themes of high-risk, high-reward project currently being promoted by several countries, including EU, Denmark, and Korea. So I think these projects require various high technological competitiveness, and individual countries does not or may not have enough technological resources to solve them independently. That's the reason why we emphasize the cooperation, international cooperation in this session and in the keynote session. So from an economic perspective, it is important to reduce the financial burden and increase R&D efficiency on high-risk, high-reward projects that require enormous R&D cost. So we should share the financial burden through joint investment, as some presenters said, by several countries and also international organizations. With this cooperation or joint investment, we could fund more and more high-risk, high-reward projects. And that will be ultimately promote global healthcare competitiveness. So I like to suggest, propose that international organization or countries, including Korea, promote the establishment of the virtual or realistic global network, or say cluster of hub and spoke for the special high-risk, high-return, high-reward missions. So we could solve the limit of resource with this virtual or realistic cluster, and we could utilize the resource effectively. So especially for this session, I could see several alpha-style R&D in several countries, including EU. So alpha-style R&D in several countries, we could group the interest missions. So then we could be connected these missions virtually or realistically. That's my comment for the global cooperation in the future.
Okay, maybe the Hani has another or additional ideas about the global collaboration, especially as a CEO of the Right Foundation. So would you?
Yes, thank you very much for inviting me to participate in this discussion. I feel like a bit of an oddball on this panel because for those of you who are not so familiar with Right Foundation is a Korean nonprofit organization that's dedicated to funding global health research and development. What makes us quite unique is, first of all, our largest funder is the Korean Ministry of Health and Welfare, and the source of the ministry's money is official development assistance, also known as ODA. And for those of you who are not so familiar with ODA funding is typically spent on building infrastructure, building roads, hospitals, schools for resource-constrained countries or lower middle-income countries. Now, Right Foundation represents a bit of an experiment. I think one of the speakers highlighted the importance of the spirit of experimentation. I really saluted those words. So the Korean government really took on this experiment to channel Korean government's ODA to support R&D with the ultimate goal of contributing to regional and global public health. So to answer your question, when I think about collaboration, the critical question for Right Foundation is what guides that collaboration? As we know, when people hold hands together to work together, there has to be something shared that will guide us to march forward together. And I think for the Right Foundation, because we are a mission-driven organization, our goal is one that's deeply tied to the value of public health and health equity. So that's one critical aspect that guides collaboration for Right Foundation. The second aspect, and I think one of the previous speakers mentioned the importance of the pipeline approach. So we at the Right Foundation think very strategically about complementary strengths. When we look at ourselves, Right Foundation, as well as Korean R&D partners, we think about what is it that Korean partners are very strong in. And we've recognized that Korean partners are very strong in what I would call engineering, process optimization, and if I were to use the vaccine development language, the CMC development, aspects to take something that already exists, make it more effective, make it safer, make it easier to operate, make it cheaper, make it more thermostable, something that allows us to simplify operations so that it could achieve global and equitable access, not just in the wealthiest nations around the world, but in some of the poorest countries around the world. So to summarize, I think for Right Foundation, the two key parameters that really guide our international collaboration, first, shared value that's anchored in public health and health equity. Second, this end-to-end approach to R&D. Nobody can do this alone. And I think one of the previous speakers mentioned that as well. So how can we come to the table together and exchange notes on what we support and what we do not support, where we lean on other partners to fill in the gaps. And I think that kind of conversation we would always welcome.
Okay, we heard about the Korean side ideas and the opinions first, and then Director, Dr. Song? Okay.
Well, about Test Valley, right? Yeah. Well, thank you very much for giving me time. Well, I think a couple of things, especially for Korean style policy or implementation. You know, I've been here, actually I've spent about 21 years in the United States and I've been here 20 years, so I could compare both. And then I learned that here, the convergence is not really working. Convergence of technology is not working here in Korea yet because we didn't have much practice yet. We didn't have a real concept. We said we are doing convergence, but it says A plus B plus C is AB or something. It has to be X or something else. So we need that kind of practice, especially in biomedical area. So we have to bring AI guys to biomedical area, but these guys are not coming because they are very, very expensive. So you have to somehow bring them here, or we have to train them. So also, I'm a material scientist. The biomedical area is learning something from material science and so on, because we did a drug delivery system about 25 years ago through these nanoparticles. But now they are developing and commercializing in biomedical area. So point is, we have to expand our horizon to other discipline areas in Korea especially, and then probably we'll bring much better achievement in Korea. Thank you.
Okay. Actually, last time with my friend, I already talked about the domains and then the conversions for the future development. But I'm the moderator, so let's keep this my idea and let's talk this thing later. Then, what about your opinions and ideas from the Denmark side or European side for the future global collaboration with some of the kind of countries and innovative R&D systems, please? Future demands or what strategies for the global collaboration? You already talk about lots of things because you manage the center in Seoul.
On the global collaboration, I think from a Danish perspective, the EU context is extremely important for us. We allocate a lot of our R&D spending into the EU system. We rely a lot on that extended expertise. So I think, first of all, that's the go-to. If we see another very big player in the Danish bio and life science, it's the Novo Foundation. I don't recall the percentage at this stage, but it's a significant percentage of the Danish life science research comes from the Novo Foundation. And what they're saying recently is we as a global company cannot just fund research in Denmark. We're global, we need to do global research close to our markets, close to our customers. So I definitely think it's a reality for us, one that we need to be active in the international scene, that the foundation system that we also rely a lot upon, private foundation sponsoring life science and some of this risk capital, that this is a global game. So I think the Danish policies are realizing that this is a global effort, and I think probably we will reshape. I don't think we'll do the Machiavelli on the innovation centers, but we'll probably try and adapt to this reality and continue acknowledging that we need to have these spearheads out, but how exactly they need to be configured, how much needs to be in agreements, how much needs to be in funding. I think we know it needs to be a little bit of everything. So we will continue in that direction.
Okay. Actually, I don't know how much your UNC could be different or similar to the Danish idea, but would you sprint and demands or some strategy for the global collaboration?
Yeah, I mean, a lot has been said already that's certainly similar. I think going back to this concept of celebrating unique perspectives and distinct approaches, especially in the biomedical field, you need to find early adopters to be able to take new technologies and bring them to the market. And the biggest bottlenecks to that are policy and regulators. And they have an important job to keep our society safe and to make sure that the drugs, that the products that come to the market are good and will protect the people. However, they sometimes are extremely conservative in their approach in how they do things. And they're more likely to say no rather than yes, let's try this. And so as a global community, we should come together to accelerate really policy adoption, regulatory acceptance, so that clinical trials are not as expensive, you don't have as many clinical trials failing, and you have more products making it to the market, even though they might be unconventional from the beginning. However, they have a lot of promise in being able to do things. Right now, if you take, for example, our DNA origami medical antiviral, most regulators don't know how to deal with that, right? Because it doesn't fit into their programs. It doesn't fit into their policies. And so they will say no. And so we have to work with them to explain them, why is this work? Why is this safe? And go through the clinical steps. We should be able to do this much faster because these technologies are available, and we can do this better as a global community by having all of the different countries come together, leverage the strengths of each country, and then deliver these to the market faster.
So, as a final comments of this discussion session, JEDI, I think, has lots of the opinions or some possible demands for collaboration. So,
you put the pressure on me with the last comments. No, I think one word I did not say about the uniqueness, but which goes to collaboration. The key today is scale. The technologies or the science that we're developing, the risk is the same everywhere, in Palo Alto, in Copenhagen, in Seoul, or in Shenzhen. But when you then scale it, the opportunity is continental in markets like China or like the US. And in smaller countries like the European countries or like Korea, obviously the upside potential is. So the concept of scale is absolutely critical to sometimes overcome what Patrick just mentioned, is this capacity of really taking these big bets. And the scale for us is the fact that we've been able to bring together the whole European deep tech ecosystem and science ecosystem that helps us. So that's point number one. Collaboration is achieving a certain level of scale. The second thing on collaboration is the diversity. That was mentioned, but let me give a different twist to it. I think if you take the European project, and again, I'm a deep believer in both French and German, but we have not achieved yet. Two former prime ministers mentioned that in reports in the last couple of months. We've not been able to achieve a common market in most forward-looking topics like healthcare, cyber, AI, and so on. And having this diversity of approaches in Europe, we need to convert that into a force for good that will allow us, a little bit like your chart, Patrick, at the beginning of your presentation, where the same problem is seen from different angles. And I think this is the collaboration that we should have before even the programs themselves, which are harder to collaborate on, is the joint capacity to anticipate. And as a French-German, I'm going to cite the chief scientist of the UK, because I think that all of us should also influx this anticipation capability in the policy stage. And I liked very much the comment of the advisor for bioscience. I think we need much more policymakers that are close to what is possible in science. Arati Prabhakar, she's actually a good friend of mine. You mentioned her. I mean, in the West Wing of the White House, I don't know how much it's going to last with the next administration, you have 140 PhDs who are advising the president on, and when you look at the CHIPS Act and when you look at the Biotechnology Act, these are not 150 pages like sometimes you see in Brussels, but it's 5-10 pages which are both very strategic but also very dense from a scientific point of view. So I think this is a way where we should collaborate more, is on this capacity of anticipating, because it's all about politics. Sorry to be a little bit diplomatically incorrect. I think that today, most of our democracies are on the defense. We were surprised by COVID. We were surprised by OpenAI. We were surprised by the war of Ukraine. The problem is, when you react, number one, it costs much more. And secondly, other people are setting the agenda for you. So I think the collaboration, between like-minded, and I like your point from the Right Foundation, we need to have shared values, is can we work, and that's much easier, on the anticipatory aspect, because I think when you create a project together, it's much easier then to fund it together, to process it together. So I would call for much more anticipatory work between our organization, and we are ready to do our job. So I'm very excited about that.
Okay. Actually, I know there are lots of the questions from the floor, and still you have the lots of comment to add on this kind of issue, but we already spent assigned 30 minutes all times. So now I would like to wrap up with this session for your future discussion, and then future possible discussion, and thank you for all of you and all audience. Thank you very much.
Thank you very much to our moderator for leading the session, and thank you to our esteemed speakers and panelists. Ladies and gentlemen, this brings us to the end of our first main session of the World Bio Summit 2024. Thank you very much for your participation until the very end. And tomorrow, we do have our second and third main session, so we ask for your continued interest and participation tomorrow as well. And ladies and gentlemen, please note that we do have our welcome dinner here at this grand ballroom. So once you leave the hall, please have all of your personal belongings so that we can rearrange the table setting and prepare for the next segment. Thank you once again for your cooperation. And for those who are joining us at the welcome dinner, the dinner reception will start here at this venue from 7 p.m. Until then, please go to room number 201 to 202. We do have some coffee and refreshment for you to enjoy. And please enjoy those refreshments and use this time to have some conversation with the participants. And please come back to this hall by 7 p.m. for those who are joining us at the welcome dinner. Thank you very much for your attendance. Thank you.
you.